Welcome everyone to our 20th annual Healthy Heart Day. We're here celebrating together what we've achieved over the last 20 years and discuss where we're headed in the next 20 years to help defeat this disease. It's hard to believe that it all started in 2004 at our outdoor health fair at our old office on King Street. A tiny fair with a few dozen people that attended. But since then, over the last 20 years, this event has grown. We've had to change venues to accommodate the larger number of participants, growing from 200 in the first year to over 700 in-person attendees over the last number of years. And over the last 4 or 5 years, as the need for more reliable health education became apparent to not just participants from Cambridge, but from those across the Waterloo-Wellington region and really across the province, we've transitioned to an online event, and now we have participants from really across Ontario, around Canada. We've had participants from out east in Nova Scotia, out west in BC, really across the whole country. And the last 2-3 years, really even participants from other parts of the world. We've had people logging in from the US, from Australia, Taiwan, India, really all of the continents. And I think that really speaks to the global nature of this disease, that we're all looking for ways to stay heart healthy and for access to reliable information. And that's really been our goal, to give you reliable information that you can trust, that you can implement practical strategies to stay heart healthy. And over those 20 years, our event has evolved. We've had different themes, different focuses, from diabetes, diet, exercise, the role of holistic approach to health prevention, new strategies, new innovations, the role of exercise. So over those 20 years, we've tried to bring you the latest in information that you can implement, that you can take home and try to stay heart healthy. This year, we're very fortunate to have an expert group of speakers that will be helping us both celebrate the 20 years, what we've achieved over those 20 years, but give you valuable insights into ways that you can continue to work at preventing heart disease in yourself, your family, and your community. So thank you for joining me. I look forward to a very exciting event with you. And over those 20 years, have we achieved anything? Have we made a difference? What we've seen is that certainly life expectancy across Canada has continued to improve. We've seen a significant increase in longevity. We're living longer and we're living healthier. The big improvement in survival and longevity has come from our defeat of heart disease. We've seen a dramatic decline over the last number of decades in deaths from heart disease. No other chronic disease state has seen that same decline in death and morbidity. So that really speaks to the power of some of the things that we're going to be talking about today. But we need to stay motivated, because one of the concerns that many of us in the cardiovascular prevention world have is that over the last 2-3 years, 4 years, we've seen a decline in longevity in Canada. We're not living as long as we did just 5-7 years ago. And at least some of that is attributed to increase in deaths from heart attack in Canada in the last 3-4 years. Why is that? Well, at least some of that has to do with the fact that Canada is an aging population. In 2016, seniors represented approximately 17% of the Canadian population. By 2031, it's estimated that seniors will represent 24 to 25% of the population. So that aging population, as the baby boomers get into 60s, 70s, and 80s, that's the age at which cardiovascular events occur, and that certainly is a contributor to increasing rates of cardiovascular illness in our population. But there's also been changes in our health habits that also explain some of that increase in heart disease. We're snacking more, exercising a lot less than we have previously, and we've gained weight. There has been a significant increase in obesity rates across Canada and really around the world. And those things really increase the risk of heart attacks, strokes, and cardiovascular illness. So as we look back at what we've achieved over the last 20 years with the various Healthy Heart Day events, It's actually really important that we look forward. We need to develop better strategies to get heart healthy, to prevent this epidemic of heart disease that's upon us. And there are exciting new developments in our understanding of heart disease and better therapeutics and strategies that we will be discussing today. Our various experts will teach us about that. And I'm so honored that we're accompanied this today by 3 experts. Dr. Peter Lynn, that many of you have seen on previous presentations of Healthy Heart Day. He joins us again today. Thank you, Peter, for joining us today. Dr. Alice Cheng, another recurrent presenter, will be speaking to us about the impact of diabetes and heart disease, and she is an expert on that. And we're so honored to have as our first time presenting with us Dr. Sonja Reichert, an expert teacher and professor at Western University in London, who will be talking about obesity and strategies to control heart health through diet and exercise. So thank you, Sonja, for your presentation that will be starting a little bit later on. And we will be joined throughout the course of this event by our exceptional health and wellness coach, Cindy Catton, a certified kinesiologist and personal trainer, who will develop very simple strategies for exercise that you can do at home. So thank you, Cindy, for joining us, and I look forward to exercising with you over the course of this event. But remember, this event is about you. I need you to implement what we're talking about. So it's really important that you set goals for yourself, SMART goals. How are you going to get heart healthy? How are you going to implement some of the things that will be discussed during the course of this event? So SMART goals should be specific. Don't just say you're going to get heart healthy. It should be specific. I'm going to get more fit. But it should be measurable. Don't just say you're going to get more fit. It has to be something you can measure. So I'm going to walk 30 minutes a day. Achievable. Make it something you can actually do. If you have hip or knee problems, it may not be realistic or reasonable to think that you're going to run a marathon. So I don't want you to get frustrated. Set realistic goals. But it should be time-bound, it should be timely. Set a time point at which you want to achieve that goal. 3 months, 6 months, I will be walking 30 minutes each day. Those are realistic goals that you can get to in that time span. Set the goal for yourself. So over the course of the morning, it's really important to me that you set SMART goals that you will try to implement. Don't just sit back and watch this event. Make it something that you are going to use to develop a heart-healthy lifestyle and strategy. This event is raising funds for Heart and Stroke Foundation of Canada. The website for donating to them is on your screen. Please, if you have the ability to donate to this very important NGO, we need the resources to help promote heart health across the country. We also want your feedback. We want to know how we did today. So the QR code that's on the screen will allow you to go to a survey. We need your feedback. How did we do today? How can we make the event better? That feedback will allow us to create a better and better event year after year. Thank you so much for joining me, and I look forward to our various speakers. It's both an honor and pleasure to introduce Dr. Peter Lynn, a friend, a colleague, and a recurrent presenter at Healthy Heart Day. I look forward to his talk year after year. He is the Director of Primary Care Initiatives at the Canadian Heart Research Centre, a health correspondent for CBC Radio, and an accomplished educator. Dr. Lynn will discuss the various contributors to heart disease and novel risk factors we may not know about. Peter.
Thanks very much, Dr. Pandey and Mrs. Pandey, for organizing this and for allowing me to speak. So today I'm going to talk about heart disease risk factors, past, present, and future. What should we be looking forward to? So if I show you this picture, everybody would say that he's at high risk of heart disease. And I think we'd all agree. We don't know a whole lot about him, but with the obesity and everything else, we could see these features. Now, if we were to roll back time and take him to when he was 20 years old, for example, if you took his aorta, that's the main pipe, and we opened it up like this, you could see that it really looks quite shiny and smooth. However, even in a young individual, you could see where the arrow is, there's already a bit of fat that's developing inside the artery. Now, if we fast forward to his age now, we might see that the arteries might look like one of these. The one in the middle, you could see it's full of cholesterol, for example. The one at the top has cholesterol here, but you could see damage to the lining of it as well. No longer that nice, smooth, shiny surface. And actually, the one at the bottom is actually not bad for, let's say, a 50, 60-year-old person. In other words, there isn't a whole lot of damage that's happened to those linings. So the question is, what is causing this damage to happen? Like, what is damaging that nice smooth surface that we were sort of beginning with? And so initially we said blood pressure. Blood pressure damages the inside of the pipes. And so therefore that would cause damage to the arteries as well. But even that wasn't clearly understood, because if you look at this statement from key opinion leaders in 1931, they said, please do not measure the blood pressure because you might want to treat it. The fear then was that if we lower the blood pressure too much, we would decrease the pressure going to your head, and therefore not enough blood flow would go to your brain. Now, obviously, we now come a far ways that we understand that the blood pressure is causing damage. But back then, you could see here, came out of clear sky, says president's physician. And then it says death due to cerebral hemorrhage, blood vessel brain in the brain broke. This was about President Roosevelt. So you could see back then, they didn't understand what was going on in terms of even the president. Now, just to give you an idea of normal blood pressure, so normal blood pressure is 120. That's when your heart is squeezing. That's the highest pressure that you'll make. And then when your heart is not squeezing, that's the resting pressure. So we just write it as 120 slash over 80. That's a normal blood pressure. Now, President Roosevelt's blood pressure, you could see numbers here, 200, 100. And so you could see that he was consistently 200 over 100. So that's a much bigger pressure. And of course, that would damage the pipes and cause all the damage that we're talking about right now. So at that point, we didn't understand. Now, of course, we do understand that high blood pressure is a big risk factor. At the same time, when we looked at arteries, we saw this yellow stuff that was sitting there. So therefore, there was cholesterol building up inside the pipes as well. And so if you go from the far left, this is when you're born, all the way to the right, you could see over time we collect more and more cholesterol in the wall of the artery. And these are the cholesterol plaques that we talk about. And then sometimes they rupture and then cause problems. So therefore, cholesterol is one of the problems that we have inside the artery. Now, these little cells are called macrophages. They're part of your army cells. But when they go into the wall of the artery, they go in and eat up the cholesterol that's inside the wall. And then they fill up with all these little white bubbles that we see. And then they become called foam cells. And as these foam cells increase, basically it makes that cholesterol plaque bigger and bigger over time. So therefore, the storyline goes something like this. The blood pressure damages the lining. More cholesterol will go into the wall. The macrophages come in, they gobble them up, become foam cells, and therefore make that plaque bigger and bigger. Now, every so often that plaque will rupture. And if it ruptures, it's like a cut on the inside. And so therefore, it's kind of like a cut anywhere. Your body will make a blood clot to try to seal it off. But in this case, the blood clot might take up the whole pipe, in which case, if it blocks the pipe, then there's no more blood flow going to your heart or going to your brain. And that's when we have a heart attack or a stroke. And so therefore, this was the picture that we began to understand, as opposed to the cholesterol just makes the plaque bigger and bigger and bigger, and eventually you run out of a hole. And in that case, we would be able to help you, because slowly you would say that I'm having, more difficulty with chest pain and things like that. But in this case, you could see somebody can feel fine, but if the plaque ruptures and then you plug up the whole pipe, you could have something very suddenly show up. And so therefore, understanding this helped us save a lot of people, because we knew that we had to break up that blood clot for these patients that were having heart attacks, for example. They also found inflammation in the plaque. So in other words, this first part we just talked about, the white balls are the cholesterol coming in, and the blue guys are those macrophages chasing them in and gobbling them up. And then they basically grow the plaque, as we saw here. But at some point, you might have inflammation going on that will make the plaque rupture. and then you form a blood clot. And then that blood clot is the thing that plugs up the whole pipe. So therefore, inflammation became of some interest. And one of the things was smoking, right? This is my anti-smoking campaign for my kids. I go, if you smoke, you're going to look like this. So when you smoke, smoking does a lot of things. One thing it does do is increases inflammation. And so they noticed that the people that smoked more in this case were more likely to have heart attacks. And so therefore, smoking became a target where we can reduce that and therefore reduce the risk of heart attacks as well. And so I'll represent this by a little flame. I'll also use it to represent inflammation in general. So anything that causes the plaque to become inflamed will, of course, make it rupture more easily. We also discovered that if you have diabetes, in other words, you have high glucose, high sugar in your blood, that glucose will stick to proteins inside the pipe and cause damage, and therefore increase your risk of heart attacks and strokes as well. So therefore, we came up with a little list. So now all of a sudden we have high blood pressure, we have cholesterol, we have smoking, we have diabetes as the potential risk factors that drive heart disease. And so this is the Framingham Heart Study where they looked at a small town called Framingham and they tracked all those people in that town over their lifetime. And what they said was that if you had, let's say, 2 or more of those major risk factors, if you're a man, then your lifetime risk of having a heart attack or a stroke is 69%, so almost 70%. On the other hand, if you didn't have any of those risk factors, then basically your risk is only 5%. So you can see a huge difference between the two, whether you had the risk factors or not. And the in between are the ones with one major risk factor, so less risky, but still risky nonetheless. So this basically told us that the risk factor did drive a lot of disease. Also, not to forget, women also have very high numbers as well. The only difference is that maybe it's slightly shifted by age. So men might have it when they're 50, whereas women might have it when they're 60. But nonetheless, women have the same kind of risk based on the same risk factors as well. So can we do something about it? The Steno-2 trial took patients with diabetes that have risk already, and they said, what happens if we treat you a little bit more aggressively, intensely? So we send a nurse to you, make sure your blood pressure is down, make sure you quit smoking, etc. And can we make a difference? And this is the usual care, conventional therapy, those people having events. And this is the intense therapy with a nurse. And you could see that there's a reduction of 50% in terms of cardiovascular disease or events. And the number needed to treat is only 5. So if you treat 5 people intensely like this, just getting them better control of blood pressure, cholesterol, those kinds of things, you could reduce one person from having a heart attack, stroke, or dying. So therefore, there's something that we can do about it by reducing those risk factors as well. This was an interesting survey. It was for fun. Women were surveyed about men. And this is what they said. They said, just for fun, this is what we're looking for, and this is what's looking for us. So definitely it has changed, and the belly now has become more prominent in our society, I think. And so therefore, obesity became of an important issue as well, because we noticed patients that were overweight tended to have more heart attacks and strokes. So if you look at a cross section, so these are CT scans where they go right across your belly, and they made it so that anything that's white is going to be fat. Okay, so the coloration of this. And so here's one individual, here's another individual. So if you look at the two of them, if you look at the fat underneath your skin, you could see that there is a difference in the amount of fat that's under the skin. But what's interesting, if you look at the fat inside the belly, you could see this person has very little white stuff inside the belly, whereas this person has a lot of white stuff inside the belly. This is fat around your intestine, your liver, those kinds of things. And so if you were to look at how much they have of this visceral fat, that's the fat that produces chemicals that, increases inflammation, increases diabetes risk, those bad things. You could see that this person has 1 liter of that visceral fat, whereas this person has 3.7 liters of that toxic fat. And so therefore, this person would be at higher risk. So therefore, obesity became an important risk factor as well. And part of that is because our lifestyle has become very sedentary, right? So we basically sit around at our jobs, we sit around when we're entertaining ourselves. And so therefore the solution was activity. So therefore exercise became very important. And I used to tell patients, go walk a dog or something like that. And they became very creative. So here's one way of walking a dog. And then here's the ultimate in walking a dog via your car. So lack of exercise is now one of the big things. And it's just movement. We want you to keep moving during the day, and that will increase your likelihood of getting rid of the fat and staying healthy over time. So therefore, the American Heart actually put this all together in what they called sort of 7 items. So diet was important, your weight was important, exercise was important, quitting smoking was important, keeping your blood pressure control, cholesterol control, and diabetes control were essential. And this became the Life Simple 7. So if you did these 7 things, you could reduce your risk of having a heart attack, stroke, or dying from cardiovascular disease. Then things started to come along like sleep apnea. So we noticed that patients that have sleep apnea, this is where they actually stop breathing. So it's not just snoring, they actually stop breathing for, 10 seconds or something like that, where there's no air moving in or out. Now that becomes a problem for the patient, and we notice that they were at higher risk of having heart attack or stroke. So if you look at sort of the side view of you, this big thing is your tongue, and here's your nose, and you're trying to breathe air in there. If you look here, basically in a normal person, there's still an airway so that the air can go back here down into your lungs. In a person with sleep apnea, if you look here, you'll see that this is blocked. And so therefore, there is no air movement. So in other words, as they sleep deeply, their tongue falls backward, it presses against that area, plugs everything up. So they basically stop breathing for, a couple of seconds. And therefore, they're not actually exchanging oxygen or anything like that. Now, you could see that that would be a problem. It's kind of like suffocating, every, 10 or 12 seconds. And so that becomes a problem. So therefore, if you have apnea where you stop breathing, you're not doing the right thing with the oxygen and carbon dioxide. So that will lead to many sort of problems in your body, and that will lead to many different diseases that you might have, heart disease being one of them. The other thing is that if you're constantly waking up, and when I say waking up, you're not actually fully waking up. It's just your brain is going, how come the oxygen's not right? So your brain becomes aroused, and then you pull your tongue forward, and that's when you get the snorting noise, and then all of a sudden you hear, them breathing again. And so therefore, you can imagine the brain can't really get good rest. And so therefore, without good rest, this is when people are feeling sleepy during the day, etc. But you can see that many different things are changing. It's being suffocated at nighttime. So therefore, obviously, many things are changing. So therefore, we need to correct that for our patients as well. It became so important that the American Heart decided to make a new wedge. And instead of the 7 things, they called it the essential 8 things, and they stuck in their sleep as well. So getting the right amount of sleep, and of course, sleep apnea is a big deal. But even for us that's not getting enough sleep, that puts us at increased risk, or shift workers, for example. So therefore, sleep becomes an important issue as well. What about infection? So we had all this COVID business. We saw that there was increased heart attacks and strokes after infections. So could infection cause inflammation and then therefore plaque ruptures and things like that? And so this is some Ontario data, and they said after a viral infection, so let's look at the first week after that. Are you more likely to have a heart attack compared to somebody that did not have a viral infection? And so this is what they saw for influenza, RSV, and other viruses, is that if you had influenza, you were 6 times more likely to have a heart attack in that first week compared to somebody that did not have influenza. So it does increase your risk. RSV is 3.5 times increased risk, and other viruses still 2.7 times increased risk. And this was increased whether you had heart disease to begin with or not. So this inflammation may play a role. We all have a bit of cholesterol plaque, so maybe the inflammation will get them to rupture and therefore cause these bad things to happen. So perhaps vaccination is a good way around this, right? So another reason to roll up your sleeve is that if you don't get the infection, you don't get the inflammation, and therefore you don't have the risk of these plaque rupturing. So perhaps that's another good reason why you should get vaccinated against those things. Your teeth are now very important. I know that it's very important for your smile, but more importantly is the gingivitis and the inflammation that goes around. More inflammation, more heart disease, they've discovered. So perhaps if we can floss to get rid of the material that the bacteria need to sort of grow. And number 2 is to brush in between sort of after meals and those kinds of things. And that way we can get rid of the inflammation around your teeth. And hopefully that will make it easier for people to avoid heart disease as well. What about stress? Okay, so stress is a big deal. I think we're all aware that when we're under stress, that's not good for our body. But why is it not good for our body? You see, this is stress in nature. Okay, so this system was built on survival. So therefore, over evolutionary time, we created this thing called the fight or flight response. This is where your adrenaline gets kicked up. You're either running away for your life or you're going to have to fight your way out. And so basically, in order to do that, we need your heart rate to go up so that you're pumping more blood to your muscles. We need your blood pressure to go up so that you can send the blood to your muscles. And we need to put more sugar into the bloodstream so that your muscles have some fuel to burn. So therefore, these things are all perfect for this fight or flight to get out of danger. And the thing only lasts for a couple of minutes at most, because either you are food for somebody else or you made it out alive. So this system is not meant to be on. It's sort of like a disaster mode that's going to get you out of trouble. Unfortunately, that same system is still in our body. And unfortunately, we can't separate stress from work or stress from traffic from the stress of an animal chasing us. So therefore, if you look at this couple, you could see that their fight or flight response is kicked in fully. It doesn't know that there's no animal there. It just knows that there's something horrific that's about to happen. And so instead of being on for just a couple of minutes and then you survived and then the system can turn off, most of us, as soon as you wake up, it stays there. In other words, it's a longer duration. It's not on and off. It's sort of on all the time. And then as you sit in traffic and then finally get to the office, you actually have more stressful moments as you move forward. So therefore, you're getting these spike ups. And so what's going to happen is that your heart rate, your blood pressure, and your glucose are going to be super high. But you don't need any of it because you're sitting inside of a car in traffic jam, or you're sitting in front of a computer or on a telephone conference call getting all stressed out. So in other words, all the resources that we're giving you, you're not burning. So therefore the extra sugar now stays there, hence more diabetes. The blood pressure is not going anywhere, and therefore it's damaging the pipe. Your heart is now having to beat really fast and work really hard. And so therefore you're putting a strain on your heart. So you can understand why this would drive heart disease and more people would have heart attacks and strokes. So perhaps we need to calm down, or at least not trigger that fight or flight. I wish there was a switch that says, no, 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 there's no animal chasing us. You don't need to kick into that. But we don't know how to turn that switch off. So therefore, what we have to do is just make sure that we don't trigger that accidentally during our day. So therefore, staying calm, deep breathing exercises, whatever you need to do that might be a good option for you. And then I was thinking about these movies that we're watching. In the olden days, the excitement was only for like maybe 2 minutes or 3 minutes, right? And then you go back to sort of the boring part of the movie. But nowadays, it's on for like 10 minutes, 15 minutes, these chase scenes and things like that. So could that be triggering our fight or flight response while we're watching our movies? And so therefore, could it be that these things are going up as well? So perhaps if you notice your heart pounding when you're watching these movies, maybe we should ease up so that we don't watch, binge watch all of them at the same time. Perhaps we need a break from those things as well. In terms of the environment, we've seen a lot of forest fire pictures and things like that. And so anytime you burn anything, if it's a perfect burn, in other words, enough oxygen, you should actually have nothing left over. You just have water and carbon dioxide, so there is no smoke. When there isn't enough oxygen, then you get these in-between chemicals that will show up, and that's what you're seeing in this smoky picture. And so these are little particles that will float in the air, and some of them are small enough that they stay floating in the air. And so this becomes a problem because we might be able to breathe all that stuff in. So anytime we have a fire, whether it's smoking or whether it's a forest fire, you're going to be creating these extra chemicals that may stay around in the air that you can then breathe back in. Now, just to give you a sense of size of these particles, this is a micron scale. So this is your red blood cell. That's the size of it on this particular scale. This is our friend bacteria. These are the infection people. And so therefore you could see the size of them. And then of course our SARS-CoV virus, COVID-19 is a tiny little bugger. And you could see that it's actually very pretty when you look at it. Unfortunately, it's caused a lot of damage to many people. And so you could see the size differential. Now, these are the large particle that's in those sort of smoke or inside forest fires or your cigarette smoke. And these are particulate matter. PM stands for particulate matter 10 microns. And so these are big enough that you can filter out with your nose hairs and stuff like that. So in other words, your body knows how to deal with this one. This is the one that we worry about, is particulate matter 2.5. They're small enough to get all the way down deep into your lungs, and some of them can even cross over to your blood side of things. And so it's a problem because it's around the same size as bacteria, which now means that your body will treat it like bacteria, try to kill it off in that way. And so it sees that it starts pouring chemicals on it. Unfortunately, it's just a chemical, so it doesn't die. And so your body attacks it some more, and now you've created inflammation. Now, if we have inflammation in your lung, that will cause damage to your lung, and that leads to the smoker's lung business. And then if we have these particles in your arteries, then now you might have inflammation inside your pipes. And if it's around those plaques, then the plaques might rupture, and then you might have the blood clot and heart attack and stroke. So therefore, because we don't know how to get rid of this particle, we start attacking it, and the inflammation will then ensue. So what are the short-term effects? It's very straightforward of these things. It's going to be irritation, so coughing, sort of runny nose and itchy eyes and irritated skin. So just irritation. But what about the long term? If it sets up that inflammation business, the long-term effects are strokes, heart disease, lung disease, COPD, lung cancer, diabetes, those kinds of things. So when there's inflammation set up, now you're going to damage your good tissue, and therefore we're going to have all these medical conditions show up. So that's why we'd like to keep these things out as best we can. So perhaps look at the sort of the weather forecast and the particulate matter that's sitting out there, perhaps a HEPA filter, so filter out the air so that you're not breathing in as much of these things. The other area I'll touch upon is microplastics. So you've heard about this. So microplastics or nanoplastics, meaning smaller bits of plastic. You could see them here. These are the fancy names that they have and the little acronyms that they have in terms of the types of plastic. Now, we've all seen documentaries. As a kid, I remember watching documentaries about how the plastic is ending up in the water and animals are getting at it. And you see these horrible pictures of wildlife eating the plastic or being entangled in the plastic. And so therefore we said this is terrible for nature. And usually traditionally we said the plastic gets broken down into little bits, and then those little bits end up in our ecosystem. The fish eat it, for example, and then we eat the fish, and then we pick up the microplastics. And I remember as a kid, it sounded so far away. In other words, it was not an immediate threat to me because it has to go through all these steps. But if you think about it, we are the first users of the plastic. And then we throw it into the environment. So the environment is getting it secondhand. It's kind of like firsthand smoke versus secondhand smoke. So we are getting the plastic exposure first, then we toss it away, and then we get a second exposure on the way back as well. So therefore, could it be that we already have plastics within our system? And so this is a paper that was published just March of this year, where they said, is there microplastic and nanoplastics in the plaques that we take out of our patients? And are those patients more likely to have heart attacks and strokes afterwards? And so just to give you background on this particular study, they were looking at the arteries going up to the brain. And normally they're nice and pristinely clean. However, in some people, it's filled with cholesterol. And if it's more than 70% blocked, it is better to go in there and clean it up and basically get the pipe open back up again. And that decreases the risk of stroke for that patient. So these patients were all slotted to have the cholesterol removed. And at the process of removing it, they said, why don't we send it off for analysis to see whether there's any plastic in it? So they did many things. One of the things, this is an electron microscope where they can take really nice pictures of these tiny, tiny things. And when they did that, you could see these little areas are pieces of plastic that's inside the cholesterol plaque that they took out of these patients. And if you look over here, you could see more plastic bits sitting here. And if you look on the top left, you'll see these white balls. Those are those cholesterol balls. So these are near those foam cells that we talked about, right? So this is just outside the neighborhood of the foam cells. And then when they looked inside the macrophages, those foam cells, you can see the white blobs. That's the cholesterol. And then you could see these guys are the bits of plastic now inside the army cells that are sitting there. So therefore, the concern is, are the plastics causing any harm and those kinds of things? And so what kind of plastic is sitting there? So polyethylene was found in these different amounts in 150 patients. So about 60% of the patients had polyethylene in them. Each one of these dots represents the results of each patient. So some patients had really quite a huge amount. Some people, sort of were down in the lower areas. And then the other one that they found was polyvinyl chloride. So of these 150 people, about 30 of them had this second plastic that they found as well. And each dot, again, is representing how much that there is. And I didn't recognize polyvinyl chloride until they shortened it to PVC. So we all know about PVC pipes. So this is PVC piping type of plastic. And this is polyethylene, which is found in bags and containers and all sorts of things that we use. This is the most popular plastic that we have in the world. Then the question is it causing any inflammation? And so you can measure interleukin-6, which is a marker of inflammation. And so here's the people without the microplastics. They had very low inflammation marker. And here are the people with the microplastics. You can see each individual, and the top one is way out here. The bulk of them are still higher than the people without the microplastics. So it seems that there is inflammation. So our body is not ignoring it. It may be attacking it and trying to get rid of it. They then looked at collagen in the plaque. That's the elastic tissue that makes the pipes strong. And so people without plastics in it had lots of collagen in there. And when you stain for it, it's all the ones in pink is the good collagen that's sitting there. The people with microplastics, they had much less of collagen. And you can see there's not a whole lot of collagen being made. And that would mean that the plaque is not as strong. The pipe is not as strong, so more likely to rupture and have events. So then they looked at that. Are they more likely to have a heart attack, stroke, or die after their surgery? Because remember, the surgery was to remove this stuff. So everybody had that done. And if you look at this over time, these are the people without microplastic having one of these heart attacks, stroke, or dying. And this is the people with the microplastic. So much more likely to have one of these events if they have plastic in them, about 4.5 times more likely to have it. So therefore, not only is the plastics being found there, it's causing something that's driving up the disease for these particular patients. Now, stay calm. I had to tell myself the same thing because it's almost sounding like we're all going to die from plastic. The idea is to reduce the plastic use. In other words, we don't have to eliminate it. We just have to reduce the amount. And we do need to avoid high temperatures. So plastics with microwave or hot temperature dishwashing or holding hot drinks, that's when the plastic gets soft. And that's when the plastic may leach out a little bit more. So we can reduce it by avoiding those high temperature, using sort of glass containers, using metal cups for hot temperature fluids. The hot water bottle, let's not put it in the car. Let's reduce the use of water bottle, but also putting in the car with the sun's heat, the plastic becomes very soft and it would leach into the water, the plastic. So perhaps if we can reduce it, that's good. And our body has lots of defenses that can keep out some of the plastic. And I'm hoping that they're going to go back to those same patients and say, what do you do? Like, do you eat a lot of plastic utensils? You know, sort of take out containers, that kind of thing. In other words, find out where is the source of the plastic going into their body versus the people that didn't have plastic in their body. What's their lifestyle difference? So hopefully we'll have more information on that. But for now, let's just reduce our use in general and let's go back to glass and steel, maybe a better way. So perhaps instead of just the 8 things, I'll add a few more to it. And so let's add in infection. So if we can avoid the infection, less inflammation. The PM 2.5 particles, breathing it in, we don't know how to get rid of it very well, and microplastics coming into our system, and of course, stress. The first 3 definitely related to inflammation. In other words, they drive inflammation, therefore more heart disease, etc. Stress is about battle. You know, your whole body is in battle station. Blood pressure goes up. All the things that are not supposed to happen when you're sitting there in front of a computer are happening. So therefore, we need to manage stress in order to avoid that damage. Unfortunately, we can't turn on that reflex or turn off the reflex that says that fight or flight, but perhaps maybe we need to control it with our breathing exercise, taking breaks, those kinds of things. So vascular protection, protect your blood vessels just like you would protect your children. And on that note, maybe we should start with our kids as well. In other words, protect them from, you know, infections and microplastics and everything else so that they will have a good future as well. We take a lot of care with many things that we own, you know, your phone and your devices and everything else. So let's take care of our piping as well, you know, because we have 60,000 miles of these pipes. So let's take good care of them so therefore we can lead a good long life. So perhaps taking time out to take a break, to let things sort of calm down a bit is not a bad idea. And it's actually good for you in the long run. And let's just reset and think about these 8 essential things plus these extra ones. How can we reduce our risk so that as we move forward, we lead a good, long, healthy life? And so we take lots of time to make beautiful things like this coffee. Let's just take a bit of time as well to take care of our 60,000 miles worth of piping. So in the next following lectures, we will learn about what we can do about it, but definitely let's take some action, and let's take some action now so that we can protect our future as well. Anyway, thanks very much for your time, and thanks for staying awake.
Thank you, Peter. That was lighthearted, but inspirational and educational. To you, the audience, what SMART goals were you able to create from his talk? Remember, this event is about you. Take it to heart, make smart goals, make a commitment to stay heart healthy. I think it's time to take a health break. We're going to be joined now by Catton, a registered kinesiologist and personal trainer. She's the owner and operator of Citrus Root Personal Training. She specializes in exercise programming for complex medical conditions like diabetes and heart disease. Cindy, we're ready for our first workout of the day.
Welcome, and join me for strength exercises. If you'd like to sit down during the session, you can. I can use this chair today, but if you have a couch or a kitchen chair that you're using, that would also be beneficial. Remember to stay nice and tall, and I'll cue you through all the exercises. Let's start with a bit of a warm-up. Just start walking on the spot, feeling very confident and comfortable here. If you need to hang onto your chair or the counter, you can do that too. But just feeling comfortable here today. If you don't want to lift your feet as much, that's okay. Or if you're feeling a little more energetic, lift those knees up, feeling nice and comfortable. We're just increasing the heart rate a little bit so that we can work through some of these exercises and warm up the body. When you're ready, take your feet a little bit wider, hip width stance, tuck in those abdominals, and we're gonna move through some squat exercises. Squat down so that you're nice and low. If you can't get this low, it's okay. Come back up nice and strong. You're using those quadricep muscles. Push your weight all through the heels. Feeling really confident and comfortable here. You're looking good at home. Good to see everyone. Nice and strong. Just a few more squats. We want to get those major muscles warmed up. Good job, everyone. Once we shift out of this exercise, we're going to move into the lunge. When you're ready, I want you to step 1 foot forward. Again, if you want to hang onto your chair, the counter, the back of the couch, you're stepping 1 foot forward, the other leg comes back. Stay nice and tall, keep the abdominals strong, and lunge down. Drop the back knee, but keep the front knee over top of your ankle, not past your toes. You're looking good, everyone. Nice and strong. All the muscles we're working here, core, hamstrings, quadriceps, even into the calf muscles. How's everyone feeling? Stay nice and tall, hang onto the couch or the chair if you need to for a little bit of balance. Good job. Let's do 2 more. Nice and strong. And again, last one. We're gonna switch our legs now. Step the other foot back, the other foot forward. Nice and strong again through those abdominals, tall through the shoulders. Lunge that back leg down. Make sure the front knee is over the ankle. Here we go. Give me a few repetitions in this position. Keeping your body nice and tall. Hang on if you need for balance. Good job, everyone. Keep going. Let's do the last 2. Last one. Excellent. Good. If you need to shake out those legs or do a little bit of movement here to keep the body warmed up, you're looking good. We're going to move into some other exercises, so I need you to relax the upper body. Move those arms a little bit because we're going to start to do some front or upper body exercises so that we can feel really confident and comfortable. Move those arms a little bit more. Good job. Okay, we're gonna do some push-ups. I'm gonna use my chair. If you wanna use your chair or the counter, you can do that too. Place your hands on the side of the chair or the back of the couch. Walk your feet back so you're in this nice long position, and then bend your elbows down. Keep the abs nice and strong. Keep working here. Down and up, working through the chest muscles, the shoulders. Your core's working because you're in that nice long plank position. Exhale through the hard part. Inhale on the way down. You're looking great, everyone. Keep going. Good. Let's do 1 more. Perfect. Good job. Okay, keep moving. You're looking really good at home. Nice and strong. Shoulder roll back. We're gonna move into some more upper body exercises. If you have water bottles or some weights at home, I want you to use those now. Bicep curls. Make sure your feet are hip width apart. Tuck those abdominals in and pull those arms up, hands to your shoulders. How are we doing, everyone? You can use cans of soup, your water bottles, or if you have some free weights at home, you can use those too. If you don't have anything, just go through the movement today. Nice and strong. Lift all the way up to the shoulders, keeping those abdominals tucked in. Looking good. 2 more here. Lift, lower, lift, and lower. Good. Shoulder roll back. Reset that position, and we're going to work through some shoulder exercises. Start at a 90-degree angle. Pull those abdominals in and lift the elbows out to the side. Good. Your upper deltoids are working here, your arms are still working, and of course your core, because you're pulling everything in, tucking the belly button in toward the spine, keeping your knees soft so you're not stretching through the arms and legs. Good work, everyone. How about we do one more? Super. Good. Shoulder roll back, relax that upper body. Let's do one plank exercise before we finish today. Use the back of the couch or your chair. Place your hands on top of the chair and walk those feet back. Keeping the abdominals nice and strong. Pull your belly button in towards your spine so you're keeping everything nice and tight. If you want to do something a little bit more advanced, walk your hand to the center and turn and do a nice side plank. Good job, everyone. One more to the front. Working here, and I'm going to turn the other way, so you're doing your back other side plank. Here, and lifting again. And you can do this for longer at home, so we're keeping everything nice and strong. Good, step out of that one. Give me a nice big shoulder roll, and thank you for joining me for our strength session.
Thank you, Cindy, for showing us what we can do, these great exercises we can do in the comfort of our home.
I'm Jennifer Michaud. 3.5 years ago, I had open heart surgery to replace my aortic valve. I was born with a heart condition. I was born with aortic stenosis. What really changed for me with my condition was when I received the news that I had to have open heart surgery. To be put back together with glue and with stainless steel and with stitches, and then to be expected to go back to normal life. Research is so important to me because I am not done my heart surgery journey. I have a bioprosthetic valve implanted, which means in about 15 to 20 years, I'm going to need another surgery.
Next up, it's a real honor and pleasure for me to introduce you to Dr. Sonja Reichert. She's a primary care physician, an associate professor, a member of the American Board of Obesity, and a clinician researcher. She is in fact the current research chair at Western University in London, Ontario, where she leads the Primary Care Research Initiative with a focus on diabetes, obesity, and the integration of exercise as medicine. She has a number of peer-reviewed articles and is a current contributor to the Canadian Diabetes Clinical Practice Guidelines, Diabetes in Remission 2023. She's an award-winning educator. Dr. Reichert holds a kinesiology degree from the University of Waterloo, and she has a number of links to our region in the Waterloo-Wellington region. She has an MSc in exercise physiology from the University of Toronto, my alma mater, and an MD from McMaster University, and she's currently working at Western University. She's an accomplished researcher and an exceptional teacher, and I'm looking forward to her exceptional teaching today.
Hello, my name is Dr. Sonja Reichert, and thank you for inviting me into your homes today and for taking the time to listen to my presentation. It is almost 25 years ago that as a lonely undergrad student at the University of Waterloo, I ventured to Cambridge Memorial Hospital. I was volunteering for the Heart and Stroke Foundation at the time, and I was asked to speak to a group of women about heart disease. Well, fast forward almost 25 years, and I'm so happy to be back in this community and speaking to the people like you in this region. Hopefully now I'm back a little bit older, a lot wiser, and I'm looking forward to imparting to you some of my clinical pearls and tips and tricks. So with that, we will cover all things prevention. So we've probably all heard the saying, an ounce of prevention is worth a pound of cure. Well, what we'll cover over the next 30 minutes or so is really dive into the topic of what is prevention and look at the topic. Next, we'll discuss what are your risk factors. Do you know your risk factor numbers? Because if you don't know them, how are you able to prevent things? Then we'll dive into the topics of obesity and exercise, and we'll finish off with an exercise where we actually pick a goal and work through how we would set a goal all the way to completion. During my presentation, you'll see a number of different colored highlights, and this is to serve as a bit of a legend. So you'll see some writing in red. These will be key takeaway moments. These will be things to really pay attention to. I'll also have some information in yellow, which will impart some information or knowledge. And then I'll highlight what's new, what's late breaking, so that you're really up to date on the latest. And finally, I'll actually ask you some questions. So if you haven't already done so, maybe this is a time to grab a pencil, a piece of paper, because I will be asking you some questions and maybe even some homework. All right, so let's start with our first key takeaway. Again, an ounce of prevention is worth a pound of cure. As a family physician who sees patients from the very young to the very old, I can truly say that if we are able to prevent a problem or prevent disease, it is often much easier to tackle the problem rather than if we leave it too late and have to deal with a complicated situation. Now, sometimes we're unable to prevent a problem, and that's, that happens, that's life. But if we are able to prevent things, that is the way to go. I'll give you an example. If we have a small wound, we don't want to ignore it. We want to dress it, we want to treat it, because I have seen sometimes those small wounds grow larger and fester, and then the next thing you know, if you've ignored it, maybe you're dealing with an amputation. So we don't want to get to that level. Now, the difficult part, and I recognize this, is that prevention is hard. You might be feeling well, and now your doctor or your healthcare provider is asking you to lose weight or to be more active, but you feel great. So the question is, how do I, do these things even though I feel well? Well, this is where I want to impart the information and the knowledge that truly prevention is worth it. It is worth it to put the time up front and be proactive, because oftentimes the outcomes are better than dealing with the endpoints or the complications. So just to reference, we have 3 levels of prevention. So there's primary, secondary, and tertiary prevention. So an example of primary prevention is preventing prediabetes, not even having elevated blood sugars, or preventing a heart attack. Secondary prevention is perhaps from moving from prediabetes to diabetes, or preventing a second heart attack after you've had a first heart attack. And tertiary prevention is typically focused around preventing the complications of a health problem that you may have, such as preventing a heart attack in someone who has diabetes, but maybe their cholesterol or their blood sugars are poor, and if we work on that, perhaps we can prevent a complication such as a heart attack from happening. So the reason I'm giving you this information is to bring you to my next takeaway. And that is, it is never too late to work on prevention. So we really have to change our mindset. So if perhaps we have a health condition or we have a challenge, it is never too late to focus on today or tomorrow. Perhaps we forget about the challenges that we had yesterday and we focus on today instead. So it is never too late to work on prevention. So this is now where I'll take a minute and ask you, in terms of your health, what would you like to prevent? We often spend more time making our grocery lists and planning our weeks ahead than taking time to think about what is important in our health that we would like to focus on. So this is a chance to take a moment and write down what matters to you. What may you want to prevent? All right, so we'll shift gears a bit and I'll speak about diabetes remission now. So I was very fortunate to be part of the researchers and the physicians who were part of writing a new guideline on diabetes remission for Diabetes Canada. And the reason why this is so exciting is that traditionally we have been taught that if we have diabetes, the longer we have diabetes, the worse things are going to get, the fewer beta cells we'll have and we'll make less insulin, and over time things will get worse and we'll all end up on insulin. Well, in my years in practice, I realized that wasn't actually what was happening to some of my patients. For some of my patients, that was in fact true. But we can think of the concept of remission as not being an insulin issue, meaning you're making enough insulin, but the insulin is not getting to the targets, to the receptors to be able to suck out the glucose back into your bloodstream and get it away from the circulatory system where it's causing problems. So if we're able to use the insulin you're having and use it more effectively, that is the concept of diabetes remission. And Dr. Cheng will speak about this in more details, but that is the main concept to think about. So, diabetes remission. So it is actually defined as having an A1C of less than 6% for at least 3 months on no medications. And I'll make the point here that, it is really exciting that we're talking about remission, that we're highlighting that it can happen, it is possible, we're changing our paradigms of how we understand diabetes, but it may not be for everyone. Not everyone may be or want to achieve remission. And in fact, we know from sort of the research that people who've had diabetes for a short period of time, perhaps those who are a bit overweight or have extra weight, they're the ones that if they tackle remission, they're the ones who are often most successful. So again, speak to your healthcare provider, see if remission is something that is possible for you. If not, that's okay too. But at least we're starting to have the conversation about this different way of thinking about diabetes, which is really exciting. So to take it back to the levels of prevention, we sort of are preventing the progression of disease. Well, in this way, we're actually reversing things and taking the timeline back. So it's not a cure for diabetes, but you might be able to move the hands of time back if you use some of the techniques that are recommended for achieving diabetes remission. I'll also make a big note. I said it's not for everyone, and especially if you're on medication for heart disease or kidney disease that protect your kidneys and heart, don't stop them. Don't stop any medication before speaking to your healthcare provider. But if this is something that piques you, you may wonder, well, how is it possible? How can we achieve remission? Well, because this is a fairly new concept and because there haven't been a lot of studies on it, the best studies we found when we looked at them had a pretty intense protocol. So they recommended, if you're using diet to try to achieve remission, to have a very low-calorie diet, and then followed with reintroducing physical activity. But essentially, the aim of the game is to try to lose weight. So the magnitude is about 15 kilograms that we found is sort of the goal in terms of trying to achieve remission. If diet is not your thing, well, then maybe you'll try exercise or a combination of exercise. And the key point from this is that the exercise was pretty intense as well. Recommended 240 to 420 minutes a week. So that's a lot. So again, this may not be for everyone. It may not be right for you. And if you do go for it, it's usually a pretty intense lifelong commitment. But if you've been diagnosed with diabetes and think this might be of interest to you, I encourage you to speak to your healthcare provider to learn more, because these are really exciting new developments in science. So now let's talk about risk factors. So do you know your risk factors for type 2 diabetes? Do you know which risk factors are modifiable or non-modifiable? Well, the common risk factors are age. So if we're over the age of 40, if we have a first-degree relative who has a history of diabetes, perhaps if you're a member of a high-risk ethnic population, so we know that folks from Asian or Southeast Asian or Arabic communities have higher rates or risks of diabetes. Perhaps if you've had pre-diabetes, if you've had gestational diabetes, maybe if you've birthed a very large baby, that could be a risk for diabetes. And also if you've had a history of stroke or heart disease, perhaps your blood sugars, high blood sugars, were the reason for those events. And we also know that having certain medical conditions can predispose or raise your risk of diabetes. And with that come often medications, and some medications can make us gain weight or affect our metabolism. So from this list we can see there are many things that we cannot change. We cannot change our genes or our relatives, but we can maybe try to get on medication if it's raising our blood sugars. And we know that through healthy eating and activity, we can sometimes, turn on or turn off some of these genes that we have in our bodies. So it's an interesting concept, but make sure you know your risks. Now, the key message from Diabetes Canada is if you are over the age of 40 to be screened at least once every 3 years for diabetes. And if you have many of those risk factors, perhaps you need to be started to screen earlier and at a yearly basis. So those are the major risk factors for diabetes, but what about modifiable or things we can really control that help with diabetes and heart disease? So we have the really nice acronym ABCDES. And A stands for A1C, so good blood sugars. B is for blood pressure. C is for cholesterol. D is for drugs. So again, maybe you need to be taking certain medications that help protect your heart and your health. E is for exercise, another E is for healthy eating, and then we have the S's, so stopping to smoke, trying to reduce your stress, and sleeping. And this is where I have the what's new button besides sleep. So we're really starting to understand the importance of sleep, not just how much sleep we're getting, but the quality of sleep. So I'll say that if you snore, or perhaps you worry or wonder if you have obstructive sleep apnea, get tested. Speak to your healthcare provider, because we know that having poor sleep, and especially sleep apnea, can contribute to the risk of diabetes and or worsen heart disease. So very important to think about sleep these days as well. All right, so now that we covered risk factors and we covered modifiable and non-modifiable risk factors, ask yourself, do I know my diabetes, my cardiovascular risk? Have I been checked recently? And if you haven't, perhaps this is where you think about who can I go to? Who can I ask for help to be screened? So key takeaway number 3. Many of these conditions, and especially diabetes, can be silent. Having high blood sugars can be extremely sneaky. You may have high blood sugars and have 0 symptoms. So I'm really encouraging you to get screened, to get tested, because it's not often until disease has progressed quite late that we get those symptoms of being thirsty or tired. And even some of my patients who have very high blood sugars never have those symptoms. So it's really important for you to be proactive, know your risks, and get screened. All right, so I've spoken here and there a little bit about weight and its impact on diabetes remission and exercise. Well, let's really hone in and tackle the topic of weight. So we know that unfortunately our waistlines are growing, and this is so important in terms of, again, preventing disease and preventing complications. So I'll spend a little bit of time on the topic of weight or obesity. And in fact, by 2030, it's estimated that almost 40% of the population will be considered overweight. Now, We also have a fantastic organization. I spoke about Diabetes Canada as a resource. Well, we also have Obesity Canada as a resource. And I encourage you, if this topic is of interest to you, maybe go to their website. They have a ton of programs for people with obesity, for patients with obesity. Check out their website, learn more about the topic. You could even get involved. They're quite active in their advocacy for this condition. So if you are interested, do check out this website. And I'll highlight that the Canadian obesity guidelines are some of the best in the world. In fact, many other countries are actually asking us, you know, what are your guidelines? Please help us with the topic of obesity. So the reason these guidelines are so well liked and they're so good is back in the old days, we simply thought of, are you overweight or not? Yes or no. Is your BMI over 30? Yes, then you are overweight. You might have even had sayings that it's your fault, or move more, or just eat less, right? That's the reason why you're carrying extra weight. Well, we've really shifted the message, and we know that obesity is actually a chronic disease, and it is a complex disease that's impacted by many things I'll show you about in a minute. And we want to focus away on just blaming the patient, but focusing on how can we help you, focusing on your challenges and your needs. So it's very important to find a healthcare provider who understands this topic and will work with you in a very compassionate and holistic way. So again, I mentioned we're moving away from that eat more, eat less, move more, because we're understanding how complex obesity is. There's a lot at play. And ideally, if you can get to the root of why you're gaining weight or why you've gained weight, that is the ideal. So we can see from this slide here, and this is an important point, obesity is a complicated mix of genetic, metabolic, behavioral, and environmental factors. So we know that there are at least over 140 genes at play that are contributing to our weight. We know that our hormones control how hungry we are or how full we are. And many of the medications we now have are using or understanding these hormones to be able to help with weight loss. Our environment doesn't help. The fact that we have processed food, it's easy to get, we're actually being more sedentary. Our environments don't help. Our brain is a big piece of the puzzle as well. And even our gut microbiome and our fat cells send signals to our body to tell us to either try and be hungry or lose, eat more or pick up that appetite, or likewise when we're full. So I mentioned about knowing your numbers. Well, know your numbers when it comes to your weight as well. Do you know your BMI? But I'd say even more important than knowing your BMI, where we agree that sort of over 25 is considered overweight and over 30 is in that obese category, is knowing your waist circumference. Because it doesn't matter just how much weight you carry, but it actually matters where the fat is or where you carry your weight. And if you carry it around your belly, well, that is the dangerous fat that we want to really take note of. And I'll also mention that for certain ethnic populations, again, those cutoffs of waist circumference and weight are different. So if you haven't already, maybe grab a waist circumference, take it around your belly, see what your waist circumference is, and talk to your healthcare provider if you're concerned. And again, we know that weight gain is natural and losing weight is really difficult. We probably all remember the show The Biggest Loser, where people had to exercise a lot. Well, what happened? They gained the weight back after they were off the TV program. So again, this is why obesity is a complex, chronic condition that we must support and work on over the long term. So what are the tools we have for managing weight? Well, we're lucky. There's sort of three main pillars. And if we look at the left of the table, we see that there's behavioral modification, there's pharmacotherapy, and bariatric surgery. So in terms of behavioral modification, there's three main things. There's our nutrition, our food, there's our activity, and then there's our mental health. And this is where I'll encourage you to sort of find your community, find your people, find your support. If you need to work with a psychologist on your reasons for eating, then do that. If you need to find an exercise therapist, then that might be a great tool as well. And there are many healthcare providers who are becoming educated and again supportive about this topic, but maybe you find a health coach. I'll give you an example. My best friend, she was actually a pharmacist, Farah Jamani. She was a pharmacist but decided to move away from pharmacotherapy, and she became a health coach. So she actually helps people change their mindset and change their patterns and behaviors and work towards goals. So get your support. Maybe it's a significant other, maybe it's a friend. I won't speak about pharmacotherapy, but just know that we have amazing medicines now that are really helping with weight loss. They are, for the most part, safe. Again, speak to your healthcare provider, but we're seeing results of up to 20% of weight loss in many of our patients, sometimes using these medicines. And for some people, bariatric surgery may be the answer. I would just like to highlight this important point that, you know, the saying is we can't outrun a bad diet. So again, you know, just exercising, we know from science, probably isn't that effective to helping you lose weight. It'll probably help you maintain your weight, and it's so important for every cell of our body. But you know, we're moving away from that. Just move more, just do more exercise. You know, your weight will get better. We know that's not often the case. So rather, you know, be active, enjoy being active, but don't, you know, sort of tie your weight loss as a marker of whether or not your exercise is successful. All right, so I've spoken a lot. I've given you a lot of information about risk factors, and we spoke about the new concept of diabetes remission, and we've covered the importance of achieving a healthy weight. But how the heck do we get there? How do we make our dreams and our goals into something that's a reality? So we will use activity to go through an example of how to goal set. So we know that most medical societies recommend around 150 minutes of moderate to vigorous aerobic exercise. So that's any exercise, you know, that gets your heart pumping, like walking or biking or swimming. And it's recommended to spread those 150 minutes over the week and sprinkle a little bit of exercise throughout your week. And if you're not able to do, you know, maybe 20, 30 minutes at a time, we know that even 10-minute snack breaks of exercise can have enormous health benefits. So just 10 minutes at a time, maybe 2 times a day, well, there you've got your 20 minutes. Another way to tackle being more active is perhaps instead of looking at time, maybe you count your steps. And there's enormous building evidence that counting our steps has big impacts on cardiovascular and health outcomes. And it's generally accepted that sort of 2,000 to 2,500 steps a day is a good bare minimum. And if we're able to get to 4,500 steps, that's even better. And if we're able to achieve 8,000 to 10,000 steps, that's when we probably achieve the most health benefits. So I always say, pick an activity, find something you like to do, that you love to do. If you don't love to do exercise, well then find something maybe that you don't hate so much. But you've got to find something and sprinkle it throughout your week. It doesn't have to be perfect. If you're doing aerobic exercise, well, try and add in some resistance exercise. We know that muscle is so metabolically healthy and metabolically active to help with weight and blood sugars and heart disease. If you've never strength trained, it's not too tricky or too onerous. Again, find someone who can get you started, and you'll be amazed at how amazing it'll make you feel to be stronger. And the final info point, you know, 150 minutes, we've seen that it can reduce the risk of most chronic diseases by 25 to 50%. So this is actually more powerful, or as powerful, of many of the best medicines we take. So I always say that exercise truly is medicine. All right, so you want to pick a goal. Let's say your goal is, I sit a lot. I sit at my desk, I'm very sedentary. I want to be less sedentary. So we know that most Canadians are very sedentary, and we know that sitting, irrespective if you get those 150 minutes, is not great for our cardiovascular or metabolic health. And so if you're not getting the 150 minutes, well, maybe you just try to sit less. So how do we sit less? No more than 3 hours at a time in front of a TV. Try and park further away. Try to, get up a few times every hour, and use technology or a pedometer or a smartwatch to get those steps in and track how you're doing. So I love the acronym of having a SMART goal. And SMART stands for make sure it is specific, measurable, attainable, realistic, and time-bound. So let's say we want to sit less. If we say, I want to sit less, maybe I'll start working on it next week. Well, next week things get busy. We'll put our goals aside. Other things come up. So we really have to try and make these goals specific and evaluate how we're doing. So let me give you an example. So let's say you want to be less sedentary. You want to be as specific as possible. I will take my lunch break at work and walk for 20 minutes on Monday, Wednesdays, and Thursdays. I know I have a lunch break, so this is realistic, it's feasible, and I will use the step counter on my smartphone to track my steps. I know that sometimes I have to travel for work, and that's, where the realistic part of it comes in. I won't be able to get those steps in on the weeks I travel. Thankfully, it's only 2 or 3 times a year, so that's okay. And I will track my progress over the next 4 weeks, and then I'll circle back and see if I've accomplished that specific goal or not. So, I mentioned setting SMART goals and how important that is, but the reality is, there's a lot that happens under the surface of the iceberg. Maybe we've had poor sleep, maybe it's bad weather, and so these best set goals don't happen. So I want to give you another tip here, and this is don't beat yourself up. You've set your SMART goal, but plan for adversity, plan for setbacks. If you know it's going to rain next week, perhaps you take your walking inside or indoors to a mall. Don't get discouraged by setbacks, but rather plan for them. And I mentioned, how important our mind is when we're working on our health. And this concept that, we just have to have more motivation to accomplish our goals is a bit of a tricky topic because, if I'm hungry, I might have all the motivation to eat a healthy dinner, but I'm not going to do it because I'm starving. I'm going to grab the first thing I can see when I walk in the door after work. So set up habits for success. Make sure perhaps you meal plan and you batch your foods so that you have dinner ready when you're hungry and you just have a healthy meal and you can just quickly eat it. So build habits, park farther away, take motivation out of the equation and set your environment up for success. Avoid that all or nothing thinking, and this is so important. How many of us have started a goal, we've not done so great at it, and then we're like, okay, well, I've overeaten today, that's it for the rest of the week. Absolutely not. That's very black or white thinking. Every day is a fresh start to be a little bit better, and every day we can do better. So forget about the past and focus on how will you accomplish your goals today and moving forward. So a key summary of the takeaways. Hopefully I've imparted to you that an ounce of prevention truly is worth a pound of cure. It is never too late to work on preventing disease or preventing complications. Diabetes remission is possible. It's not for everyone, and please speak to your healthcare provider if this topic has piqued your interest and you'd like to learn more. But we know that if you have diabetes for not too many years and you've got some extra weight, well, maybe this is a goal or a topic you'd like to explore more. Most of our symptoms of chronic disease are silent, so be screened, know your risk factors, understand and be proactive, and be a self-manager. We know that many of our health conditions can be improved with just 5% of weight loss. So we have so many amazing tools and treatments now. So if you'd like to learn more, go to Obesity Canada, speak to your healthcare provider to learn more about this as well. And setting SMART goals is brilliant. It's so important. But if a goal doesn't work out, don't get discouraged. Plan for your setbacks. And remember that every day we can be a little bit better and try to prevent disease moving forward than we did yesterday. And with that, thank you very much.
Thank you so much, Dr. Reichert, for your exceptional presentation. I think we can all take a wellness break now. Let's get up and stretch and put into action the motivation I've gotten and hopefully you have as well from our speakers. Let's welcome back our wellness coach, Cindy Catton.
Welcome to our stretching session. If you'd like to stand with me, please feel free to do so. If you prefer to sit down, that's okay too. Make sure you're looking at me throughout the exercises so that you know what you're doing at home. If you're standing with me, nice and tall through the body, pull those abdominals in, and we're gonna start with some lower body stretches. Step 1 foot forward. Place your heel down, stand nice and tall still, and I want you to feel a bit of a stretch through the lower leg and calf. If you need to, toe goes down and lift back up. So you're doing a bit of an active stretch if holding is a little uncomfortable. Work through this a few times. If you'd like to tip forward a little bit more, you're gonna activate those hamstrings. Feeling comfortable again, nice and tall through the body, pull those abdominals in. You're looking good at home. Stay with me, feel the stretch. You can hold stretches 10 to 15 seconds, longer if you feel more comfortable, or less time if it's a bit uncomfortable. Let's release that stretch, relax the body, walk out the legs a little bit, and we're gonna do the other side. Step forward, toes come up, heels down. Nice and tall through the body, so you're just stretching through the lower calf. When you're ready, tip yourself forward, support through the other leg, knees slightly bent. Pull the toes up. Looking good at home, feeling the stretch through the back of the leg, in through the hamstring. Nice and tall through the upper body. Good, keep going, stretch through, and relax those body muscles, and relax the body. A little bit of a stretch or walk through if you need to. Good, relax the upper body so that you're always tall and abdominals pulled in through these stretching exercises. Let's work through the upper body now. Take those hands behind. So I'm gonna clasp my hands behind me so you can see what's going on. Drop the shoulders down and feel nice and strong through the chest. We're opening up through the upper body. Make sure your chin's nice and tall and pull those abdominals in. How are we doing at home? Feeling good? And we're gonna release that stretch, relaxing through the arms and shoulders again. Shoulder roll back, relax through the muscles in the lower legs, pull the abdominals in. Stretch through the upper back this time. Interlace the fingers, round out the shoulders forward, and stretch through that body. You want to separate the shoulder blades a little bit so that we're really working through those muscles. How does that feel? A little tight, I bet. And relax those hands down, shake out the arms, roll those shoulders. Looking good, everyone. We're gonna go back to the legs. Take a nice wide stance at home. Make sure you're feeling comfortable, pull the abdominals in. This time we're gonna work through the inner thigh. Shift your body to one side, stay nice and strong. Feel the stretch through the inner thigh. And if you wanna add a little bit more, take the arm up. So now you're stretching through the back and side muscles. Good. Again, 10 seconds, 15 seconds, whatever you're comfortable with. If you need a little bit more time, go ahead. We're gonna switch to the other side, leaning to the one side. Make sure that foot's nice and strong, knees not too far past the toe. Feel the stretch through the inner thigh, pull those abdominals in. Take the arm up if you're ready, so you feel a nice long stretch through the side, into the muscles, in through the back, and still through the inner thigh. Good, nice and strong, feeling confident and comfortable, and then release. Good job, everyone. Shoulder roll back. Let's work through some upper body shoulder muscles. Pull the arm in towards the upper body. Make sure your knees are relaxed. Or if you're sitting down, it's okay, but sit tall. Keep those abdominals tucked in. Pull the elbow in towards the body. We're gonna shift from the shoulder stretch into a tricep stretch. If you can, pull the elbow back over top your head. Looking good, everyone. Relax that side. Shoulder roll back, reset those abdominals. Pull the arm in. The other side this time, across the body. You should be feeling the stretch through the back and the shoulder. Good. Nice and strong, nice and tall. And now take that one up and over. Good job. Pull through the arm. If you can't get quite this far, it's okay. Still feeling comfortable here. Again, holding stretches 10 to 15 seconds. Shorter if they're too uncomfortable, longer if you're feeling great. And relax that side. Good. Shoulder roll back. Let's work through the arms a little bit. Take one arm out, pull the fingers down. You want to feel the stretch here through the forearm and sometimes into the bicep. Remember to relax the arms and legs. Pull the abdominals in. Looking good at home, everyone. Relax that side, shake out the arms, and try the other one. Pull the fingers down just gently so that you're feeling the stretch through the forearm, sometimes into the bicep. Good job. Abs are tight, legs are relaxed, or if you're sitting, nice and tall in the chair. Good, and relax here. Shoulder roll. Let's work through the neck a little bit. Drop the chin down here towards the chest so that you feel the stretch through the back of the neck. Take a nice deep breath in and shift your head position, ear to shoulder, stretching through the opposite side. Good. And relaxing here. Back to center or neutral position, and then drop the ear to the other side. Keeping those abdominals in. We're still working those at home, nice and tall in your chair or standing with me. And then shift your head back to neutral position. Look up at the ceiling. Feel the stretch through the front of the body, in through the neck, and relax here. Back to neutral position. Do a nice big shoulder roll for me. Good job. Okay, one more. Take those hands up. Inhale, reach for the ceiling, and relax back down. One more time. Inhale, reach up. Stretch through up to the ceiling. Take it to one side, nice and gentle, and the other side. Again, stretch through that body, and relax back down. Shoulder roll back. Thanks everyone for joining me.
I'm feeling so much more motivated and positive about moving forward. Remember, I need you to make those SMART goals. We've talked about that a number of times during this presentation. You need to take heart. You need to develop strategies to stay heart healthy, to keep your family healthy and your community healthy. Write down those SMART goals, and remember, we need your feedback. The QR code on the screen takes you to a link where you can provide us feedback. How did the event go today? Were there things that we could do better? We need to learn from you so that next time we can do even better.
As women, our life stages come with unique risk factors for heart disease and stroke. Like after pregnancy, when Julie's heart arrhythmia intensified, or the high blood pressure Carissa monitors since her pregnancy. And then there's my mom, Lynn. After menopause, her high blood pressure contributed to her stroke. Know your risks.
It gives me great pleasure now to introduce our next speaker, a friend, a colleague, and again, a frequent presenter at Healthy Heart Day. I've learnt so much from Dr. Cheng. She is a member of the Division of Endocrinology and Metabolism at Trillium Health Partners at Credit Valley Hospital in Mississauga, and at St. Michael's Hospital at the University of Toronto, where she is an associate professor in the Department of Medicine at the university. Dr. Cheng will discuss to us today the impact of diabetes on heart health, new approaches to diabetes management, and the potential for diabetes reversal. I'm so excited to hear what she has to say.
Hello everyone. It is such a pleasure to be part of this Healthy Heart Day yet again. And congratulations to the organizing team for creating this long-lasting, very important educational event for the public. It's a real pleasure to be part of it. Again, my name is Dr. Alice Cheng, an endocrinologist from the University of Toronto, and I'm going to be sharing with you some thoughts about diabetes with no sugarcoating it. So the questions that we're going to try to answer are the following. What are the different types of diabetes? How does one diagnose the diabetes? Why do we care about finding diabetes? How do we treat it? And whether or not type 2 diabetes can actually be reversed. So let's start off by defining diabetes. What is diabetes? So diabetes is a chronic disease in which a person has high blood sugars, either because their body does not respond to insulin and or their body does not make enough insulin, which then begs the question, what is insulin? So insulin is a naturally occurring hormone that we make from our pancreas, usually in response to eating, but not just in response to eating. We need to have insulin circulating at all times. And insulin's job is to really direct glucose or sugar, which is a fuel for the body, into the right places, into storage so that we can use it in the future. And when people develop diabetes, either because their body does not listen to the insulin or they do not make enough of it or a combination of the two, then what ends up happening is that the sugar is not put away into storage, but is allowed to stay in the blood, which can then result in the problems that we can see when someone develops diabetes. Now, diabetes is a global issue. This is not specific to Canada or North America. It is truly global. And these are data from the International Diabetes Federation that as of 2021, an estimated 537 million people are living with diabetes around the world. And what you see on this figure is that the arrows represent the percentage increase of diabetes cases that are expected within the different regions from 2021 projected to 2045. And what you can appreciate, the North American one in the green on the top left, an expected 24% increase in diabetes. So this is not going anywhere. And if anything, we need to do our best to try to curb that increase that is coming. And if we focus specifically on Canada, now these are data up to 2018, so already out of date, but an estimated 3.4 million Canadians are living with diabetes. And that represents a significant increase over time between year 2000 to 2001 to 2017 to 2018. And this is continuing to increase. So again, a global issue, but also definitely a Canadian issue. So what are the different types of diabetes? And to illustrate that, I'm going to show you some examples of individuals who live with those different types of diabetes. So let's start off with this. So looking at these pictures, I'm hoping that you're able to recognize these famous people. There's Nick Jonas on the top, Halle Berry, and Theresa May. And what they have in common, other than being famous people, is that they all live with type 1 diabetes. So type 1 diabetes represents a form of diabetes whereby the body does not make enough insulin. So their pancreas is no longer functioning properly and therefore not able to make enough insulin. And this represents about 10% of the overall diabetes population. Here are some other famous people. So hopefully you recognize Larry King on the top left, Tom Hanks, and Randy Jackson. And what the three of them have in common is that they all have type 2 diabetes. So what is type 2 diabetes? So type 2 diabetes is a situation whereby the body is not listening to the insulin properly, and the pancreas is not able to make enough extra insulin to compensate for that resistance. And this accounts for nearly 90% of the overall cases of diabetes that we see. Then we have here Salma Hayek and Mariah Carey, both pregnant in these pictures. And what they have in common is they had gestational diabetes. So gestational diabetes is diabetes that occurs during pregnancy and then goes away usually after pregnancy. And the reason is because in pregnancy, the placenta is making hormones that increase that insulin resistance. And then if the pancreas is not strong enough to make extra insulin to compensate, then you can end up with increased blood sugars, which is what happened in these two cases, or in general with gestational diabetes. And this accounts for about 1 in 18 pregnancies. And if one develops gestational diabetes, that's usually a sign that that person's pancreas is not working at 100%, and therefore they are at higher future risk of developing type 2 diabetes. So type 1 diabetes, type 2 diabetes are the two main types of diabetes, with type 2 being the vast majority. And then gestational diabetes can affect 1 in 18 pregnancies and is a short-term diabetes, if you will, for during the pregnancy itself. Now notice nowhere in here did I say whether one diabetes was quote unquote worse than another kind. We do not use those words when describing diabetes because that's not what it's about. These are different reasons why diabetes develops, therefore the treatments that we offer may very well be different, but there is no worse kind of diabetes than another. It is all about how one treats or manages the diabetes. That is what is most important. Now here's a sentence for you. Since I feel well, I cannot have diabetes. Is this true or false? This is definitely false. The vast majority of people who are diagnosed with diabetes have no symptoms. They are usually picked up on routine testing or screening, and that's how it's actually found, which is why I encourage everyone watching this to make sure that you are getting the proper screening done by your healthcare team. And what is recommended by Diabetes Canada is that when you hit the age of 40 or older, you should start screening. And that screening for diabetes should occur at least once every 3 years. So age 40 is the age at which everyone should start screening, and it should happen once every 3 years. However, if you have risk factors, that screening does not wait until you're 40 years of age. You can start screening earlier. So what are these risk factors? So one risk factor is age, and we've already talked about being age 40 or greater. Another important risk factor is having a primary relative or first-degree relative who lives with diabetes. Now this would be your mother, your father, or brothers or sisters. Another would be if you come from a high-risk population. Now the high-risk populations are essentially every non-white ethnicity, myself included, would be considered within the higher risk populations. Therefore, screening for diabetes may need to take place at a younger age. The other one would be if somebody already has pre-diabetes, which means blood sugar levels that are above normal but not quite reach the diabetes level. That person is definitely at risk of progressing to diabetes and should be screened regularly. The other scenario is if you have complications related to diabetes already, such as heart disease, very relevant to today's program, stroke, or circulation problems. If you had diabetes in pregnancy or gestational diabetes, we know that you're at higher risk of developing type 2 diabetes and therefore should be screened earlier and more frequently. If you have other risk factors like high blood pressure or high cholesterol, or an increased waist circumference. For younger women who have polycystic ovarian syndrome, that is essentially an insulin-resistant state, but manifesting in a young woman of reproductive age, causing her periods to not be as regular. If someone has schizophrenia, they're also at higher risk of developing diabetes. And then one physical exam finding that all of you can look in the mirror and see if it applies to you is if you have something called acanthosis nigricans. So what is acanthosis nigricans? So acanthosis nigricans is a darkening of the skin that can be seen in the armpits or seen on the back of the neck. Oftentimes people think it's dirt on the back of the neck and they're trying to scrub it off, but it won't come off because it's not dirt. It's an actual darkening of the skin and a little thickening of the skin. And when that happens, that is a sign that this person has insulin resistance and is at risk of diabetes and certainly should be screened properly by their healthcare team. Now, I said the vast majority of people diagnosed do not have any symptoms, but some people will have symptoms when they present because their sugars are quite high. So what are symptoms of very high blood sugar? So symptoms of very high blood sugars are mainly really thirsty, going to the bathroom for urination very frequently, feeling maybe hungry, blurry vision, and other ones that are listed here. But the most common ones are very, very thirsty, peeing a lot, and having the blurry vision. Now, if you also have weight loss that's unintentional as part of this syndrome, then it's very important to seek medical attention, because that means that your sugars are very high and you're actually starting to waste away muscle and fat, and it's important that that be diagnosed. But don't wait until you develop symptoms to get screened. Make sure that you are screened regularly by your healthcare team, especially if you're a higher risk individual. So, how does one diagnose diabetes? Blood tests. The blood test can either be a fasting blood test, in which case a level of 7 or greater is diagnostic for diabetes, or 6.1 to 6.9 is diagnostic for pre-diabetes. Another blood test that could be done instead of a fasting glucose is a hemoglobin A1C. This is a blood test that can be done in the non-fasted state and is a measurement of sort of average sugars in the last 3 months, because it's a measurement of how much glucose or sugar is stuck on your red blood cells, and your red blood cells live for approximately 3 months. So an A1C of 6.5% or greater is diagnostic for diabetes, and for pre-diabetes would be 6.1 to 6.4. Another test that could be done but is not done nearly as often anymore is an oral glucose tolerance test. This is sort of a challenge to your pancreas to see how you do. So what happens is you go to the lab fasting, a blood sample is drawn to determine your fasting glucose, then your pancreas is challenged with 75 grams of glucose in a drink, very sweet drink. And then you sit in the lab for 2 hours, and 2 hours later, another blood sample is drawn to see what your glucose level is. So we're challenging the pancreas and seeing how well it does. Now, this test is not done very often. It is done in pregnancy. And if it is done, it is important that after you drink the drink, that you sit and not walk around. Because if you're walking around and moving, then you're actually burning some of that glucose, which then alters the parameters of the test. So the test is really meant to be one, show up fasting, get your blood drawn, drink the drink, sit down for 2 hours, and get the blood work done. So why do we care? Why is it important to diagnose diabetes and to do so as early as possible? And the reason is because if we do not treat diabetes effectively, it can in fact result in various complications or damage to different body parts. So the eyes could potentially be damaged with long-term high blood sugars. Someone could develop kidney disease. You could develop nerve problems, particularly in the feet. You can then develop maybe ulcers of the feet. You may hear about people who've had amputations related to diabetes, and that's usually because of a nerve problem, so they don't feel things, and then they step on something, don't realize they've stepped on something, a cut has occurred, it may become infected, the circulation is not as great, and then they end up with an infection, which can then lead to amputation. There's also potential for stroke, circulation problems I already mentioned, and then again, very pertinent to this program, heart disease is also possible. But we can reduce these risks, and I think this is a critical thing for everyone listening to this to remember, that we do have the power to change that trajectory. And how do we do that? Well, we do that by achieving all the components of a checklist. So it's important that we address the various risk factors that people with diabetes can have. So controlling the blood sugar, the blood pressure, as well as the cholesterol. Certain organ protecting medications, and I'll tell you what they are shortly. These are utilized to protect the heart, protect the brain, and protect the kidneys. And then also regular screening for potential complications that may develop, like eye exams every year or 2 years, regular foot exams at least once a year, and regular foot care by the person living with diabetes, and then regular urine testing that should be happening once a year. So these are important things, checklists that need to be accomplished in order to control the diabetes well. And then very importantly, not adding stuff to the problem like smoking, therefore stopping smoking if you are a smoker. Now from a food perspective, I'm going to go through this very quickly because there are other components of this program that you're going to hear from experts. But on a very simple, handy food guide for someone living with diabetes is the handy portion guide, and handy meaning you can use your hand. So a fist, one fist, your personalized measuring cup, one fist of fruit/grains and starches in a particular meal, 2 handfuls of vegetables, heaping handfuls of vegetables, 2 hands holding it, 1 palm thickness of a deck of cards in terms of protein or meat and alternatives, and then fat limited to the tip of your thumb. What's great about this handy portion guide is that, your hand, you're not going anywhere without it, so this is your personalized measuring cup. And then every meal that you sit down to, you can sort of think to yourself, am I following this general guide? And then of course, physical activity is a critical component. And again, this is going to be covered much better in other parts of today's program. But generally we're looking for 150 minutes over the course of a week, spread out over the week, not all in one go. And ideally a combination of resistance as well as aerobic exercises. Now, the importance of all of these things have been recognized by a variety of organizations around the world. So this is a figure developed by the American Diabetes Association in conjunction with the European Association for the Study of Diabetes in their guidelines. And this is really looking at the importance of the 24-hour behaviors and their impact on type 2 diabetes. And what it emphasizes is the importance of the 5 S's. So the 5 S's are sitting, stepping, sweating, strengthening, and sleep. So let's go back to sitting. The advice is don't sit for too long. So if you're watching today's program, as you're watching the program, every now and then stand up and do some steps in front of the television or whatever you're watching it on, and then sit back down. So prolonged sitting is discouraged. Stepping, walk. Walking is what is recommended. Sweating, so moderate to vigorous exercise on a regular basis throughout the week is recommended. Strengthening, and that's not emphasized enough, but the importance of resistance training and building muscle is critical to helping type 2 diabetes. And sleep. Sleep is absolutely critical for many things in health, including repairing the body, but definitely impacts glucose control, blood pressure, heart, etc., etc., etc. So the 5 S's of sitting, stepping, sweating, strengthening, and sleep. Now here's another statement. Some glucose lowering medications have been shown to not just lower glucose, but also save lives. Is this true or false? And the good news is this is absolutely true. So not only do we have that checklist of things that we can control and do to help lower risk, but now there's specific medications that have been shown to lower risk as well. And you want to make sure that you're on these medications if it's appropriate for you. So speak to your team about this. So what are these medications that we're talking about? They come from 2 classes of medications. The names are not so important for the class, but SGLT2 inhibitors and GLP-1 receptor agonists. But what I've listed for you are the names of the 6 specific medications that belong to these 2 classes. So there's Jardiance, Invokana, Forxiga, and there's Victoza, Ozempic, Trulicity. And these are medications that have data that show that they protect organs like the heart, the kidneys, the brain, independent of the fact that they lower your blood sugars as well. So they're oral medications or injectable medications. These are the dosages that have been shown to be effective, and these are the relative costs. Now, with the cost, bear in mind that depending on where you're watching this from, because I realize this could be in fact visible across the country, but for those living in Ontario, the government, if you're on government coverage, will cover the 3 medicines on the left, the SGLT2 inhibitors, and we'll cover Ozempic or Rybelsus, which is the oral form, pill form, in Ontario. Other provinces may have different coverage. So the things to consider then is ask yourself, do I have any heart disease, stroke, circulation problems, or heart failure? Do I have any kidney disease? And if you do, then you must be on one of those medicines that I showed you previously. Then other questions to ask is, how are my sugars? Am I at risk of a low blood sugar? How's my weight? How's my kidney function? And do I have coverage for medications? And then this checklist will sort of help you and your team decide about what treatments are best for you. So these are the things to discuss at your appointment. How is my A1C? How are my sugars doing? How's my blood pressure? How's my cholesterol? Am I on the organ protecting drugs I should be on? Am I doing the exercise, eating, dietary modifications? Do I smoke? If I do, I need to stop. And then finally, am I getting the screening that I require for my eyes, my kidneys, and my feet on a regular basis? And then finally, the last thing you and your team can discuss is, I want to do all these things, but I want to do these things in the simplest way possible. So are there combinations I can take that might help? So the final question then is, if you have type 2 diabetes, can it be reversed? Now I'm going to change the question because the word reversed is not the right word to use. The better concept is, can type 2 diabetes be put into remission? And the reason why remission is a better word is because remission is really suggesting that we're just putting it away, pulling it back, often temporarily, because we have not changed your underlying pancreas. We have not changed your underlying genetics, which is still the biggest predictor of whether or not one develops type 2 diabetes. So what we're doing is just pulling back, and there's a potential for recurrence. Whereas if you say reversal or cure, people think, oh, I'm fine, everything's great, and I can completely change the way that I'm behaving to have achieved the remission in the first place. So I think remission is a far better term. And in fact, in 2022, Diabetes Canada put out a set of guideline recommendations on diabetes remission. And they defined it as, if you're no longer on any sugar-lowering medications for more than 3 months and have achieved essentially normal blood sugar levels, A1C under 6%, or you can remission to prediabetes 6 to 6.4, but you have to be on no medications. And then there has to be routine monitoring to ensure that the remission remains. But how can remission occur? Now, from an evidence-based perspective, remission can happen with two strategies. One would be through bariatric surgery, which is surgery that is in Ontario covered by the government for those who live with significant obesity, where there's surgery to actually change the anatomy of the stomach and the gut so that absorption is altered and tends to produce the greatest weight loss. The other potential is through very low calorie diet with physical activity. Now, this very low calorie diet, I'm going to show you more details, may be harder to achieve for many people, so it may not be appropriate for everyone, but it is an option on the table. So what does that very low calorie diet for remission look like? So there's 3 phases. The first phase in the pink is meal replacement, complete meal replacement. So you're no longer eating food, you're using meal replacements for 3 to 5 months. Then phase 2 is slow reintroduction of real food. And then the third phase is maintenance. So if we take a closer look at the first phase of meal replacement, complete replacement, we're talking about 800 to 900 calories a day. And then we're also looking at complete meal replacement with multiple meal replacements per day, 3 to 4 meal replacements per day, either shakes or bars or things of that nature. And after 3 to 5 months of that, then there's slow food reintroduction, whereby you have 2 meal replacements and then you're allowed 1 meal of real food. So if we take a closer look at what that is, so on the left, you can appreciate the kinds of meal replacement shakes or suitable high protein, low fat soups and stuff that are available in Canada. And then on the right would be an example of what one could then take during the second phase where food is being reintroduced. But remember, food is reintroduced in one meal only, and the other 2 meals are still full-on food replacement. And then after this, then you still need to go on a weight maintenance third phase with proper food as well as physical activity as shown on the far right. So is that for everyone? I think the answer is no. But for some people, it may very well be feasible. So there is an important shared decision-making checklist that one needs to consider. There needs to be a recognition that this is not a cure for type 2 diabetes. This is simply putting it into remission. Now, if one is in remission for the rest of one's life and then you die of something else, then yes, I guess that was a cure, but still not a cure because, like I said, you have not changed the underlying pancreas nor one's genetics. What you've done is simply kept it in remission. And this often requires a maintained minimum of a 15 kilogram weight loss for this to be effective. In other words, this is an effective strategy only for those who also live with significant overweight or obesity, and there often requires a significant weight loss that has to be maintained. And this is going to work best for someone who has had diabetes for a shorter period of time of less than 6 years and also has excess body weight. So not for everyone, but something that could work for certain individuals. So finally, where can you get more information? I encourage all of you to visit the Diabetes Canada website at diabetes.ca, where there's a wealth of information for people living with diabetes, pre-diabetes, as well as healthcare providers. And there's also a website called guidelines.diabetes.ca, which has a section dedicated for people living with diabetes where you can get evidence-based information. And remember, you are the center of your diabetes team, the most important player on that team. And then you're surrounded by people there to support you. Your healthcare team will, of course, include your family doctor, perhaps some specialists, a diabetes nurse, diabetes educator, a dietitian, your pharmacist. A whole slew of individuals are there to support you, so please take advantage of all of the members of the team. And remember, it's all about early investment. We ask people to invest early money-wise, financially, so they can retire wealthy. Health is no different. You need to invest early so that you can retire healthy. And I'm borrowing this slide from Dr. Peter Lynn. The reality is, if we pick one disease state like heart disease, I mean, this is sort of the trajectory people will take, and we're all going to die eventually, but this is the trajectory one may take. But someone living with diabetes, that trajectory may be changed. And what we're hoping to do is, with proper diabetes care, shift that trajectory from the diabetes timeline closer to the person not living with diabetes timeline. And we now have the tools to achieve that, so that we can do what's shown in this Heart and Stroke Foundation ad campaign. It's all about how will we spend our last 10 years, and we want to do so healthily, which means improving quality of life and, if possible, quantity of life. So with that, I thank you for your attention. To summarize, diabetes is common, it's impactful. There are lots of things available for all of us to do now to help change that trajectory when it comes to diabetes. Remember the ABCDES's checklist and check out some of the website resources that are available to you. And remember, you are the center of your team. Thank you.
Thank you, Dr. Cheng. Wow, what a rich source of information. I have learned a great deal here today. Did you set some SMART goals yet? Again, this is about you. This is a day for action. Set those SMART goals. Remember, it's about making a commitment to heart health. That starts with you. I think we can all take a wellness break now. Let's put into action the motivation I've gotten, and hopefully you have as well, from our speakers. Let's welcome back our wellness coach, Cindy Catton.
We're going to do a meditation and relaxation session. If you'd like to sit down in the chair that you're in, move to the couch or something more comfortable, please feel free to do that now. I would encourage you to close your eyes and relax during this session as much as possible. Inhale nice and deep through the nose. Exhale through the mouth, and let your body start to relax. Feel very calm, very relaxed. Inhale through the nose, exhale through the mouth. Slowing down your breathing, slowing down your heart rate. I'm going to shift myself back into the chair so that I'm relaxed and I can talk you through the next few minutes of your meditation and relaxation. Again, inhale and exhale nice and slow. Clear your mind of all thoughts. If thoughts come into your mind, let them go. Inhale through the nose, exhale through the mouth. Slowing down your breathing, slowing down your heart rate. Let your body feel relaxed and press into the chair that you're sitting into. Let your back touch the chair and sink deeper into it, relaxing your body, slowing down your breathing, keeping your eyes closed if you feel comfortable. Your arms should be relaxed by your side. Your hands can be on top of your lap, or your hands can be open-faced, palms facing upward. Inhaling again, and exhaling. Again, letting your back relax into the chair and thinking about dropping your shoulders down. In this muscle relaxation, we're going to move through a series of body movements that are going to help relax the muscles in your body. Close your eyes as tight as you can, squeeze them shut, and then relax them. Let your body feel the difference between the contraction of the muscle and the relaxation. Squeeze your lips together nice and tight, and then relax them. Let your mouth fall slack, your jaws open if it's in a relaxed position. Drop your shoulders and breathe in through the nose and out through the mouth. Press your shoulders into the chair and provide a little bit of pressure into the back of the couch or the chair, whatever you're sitting in right now. Feel the muscles contract and then relax. Let all the tension go from the muscles. Feeling very calm, very relaxed. Inhaling through the nose, exhaling through the mouth. Drop the shoulders down again. Any thoughts that are coming into your mind, let them go. Letting all the tension out of the body. Inhale through the nose and exhale. Work through the core this time. Squeeze the abdominals. Press the belly button in toward the spine, contracting those muscles and relaxing. Inhaling through the nose, exhaling through the mouth. Work through the legs this time. Press your legs into the chair underneath you. Squeeze the muscles and then relax. Let the tension release through the muscles. Work further down into your calf muscles and your ankles. Press your feet into the floor, pressing down. Feel the strength through the muscles and then release the muscles. Let all the tension go. Inhale through the nose, exhale through the mouth. Relax your shoulders again. Relax your mind. Let all the tension go from your body. I want you to crunch your toes up this time. Squeeze them inside your shoes or slippers, whatever you're wearing right now, and then release them. Let all the tension go. Feeling the change in your body, working up through the ankles, the calves, the knees, in through the thighs. If your hands are still placed on top of your body, on top of your legs, squeeze your hands into fists and then release. Inhaling through the nose and exhaling. Letting your body relax. Letting all the tension go. Clear your mind and sit for just another second while your body relaxes. Letting all the tension go from your body. Continue to breathe through the nose and out through the mouth. When you're ready, you can open your eyes, wiggle your fingers, wiggle your toes. Thank you for joining me.
I'm feeling so much more motivated and positive about moving forward. Remember, I need you to make those SMART goals. We've talked about that a number of times during this presentation. You need to take heart. You need to develop strategies to stay heart healthy, to keep your family healthy and your community healthy. Write down those SMART goals, and remember, we need your feedback. The QR code on the screen takes you to a link where you can provide us feedback. How did the event go today? Were there things that we could do better? We need to learn from you so that next time we can do even better.
If someone suddenly collapses and doesn't respond when you touch or speak to them, if they aren't breathing or are making strange gasping sounds, they might be having a cardiac arrest. With 3 simple steps, you could help save a life. Don't hesitate. Every second counts. First, call 911 or ask someone to call for you. If there are people around, shout for someone to bring you a defibrillator AED. Next, start CPR immediately. You can do this. Put one hand on top of your other hand and push hard and fast in the center of the chest. Push about 100 to 120 times per minute to the beat of Stayin' Alive. Keep your elbows locked and push hard. Keep going until someone else takes over. If someone brings you an AED, use it as soon as possible. It's easy. Turn it on and follow the voice prompts. Don't worry, the AED will tell you what to do and won't hurt you or the person. The 911 dispatcher can coach you through all of the steps. You can save someone's life using your phone, your hands, and an AED. Don't hesitate. You can't hurt, you can only help. heartandstroke.ca/CPR.
Thank you so much for staying with us through these various presentations today. We've all been talking about preventing heart disease. It all begins with you, and that's the focus of my presentation today. I'll try to summarize some of what our previous speakers have spoken about and talk to you about new strategies for preventing heart disease. So why have we spent these 20 years of Healthy Heart Day to try to promote heart disease? And it's because despite all of these various advances in our understanding and treatment of heart disease, every 7 minutes a Canadian dies from heart disease or stroke. During the 3 hours of our presentation, we will have lost over 30 Canadians to a disease that is mostly preventable, one that we know effectively how to treat. We need to do better. We can do better. And that's what the focus of Healthy Heart Day is all about. But we have made huge progress, as we've talked about. Deaths from heart disease have been falling steadily for the last number of decades. In fact, of all of the chronic diseases in our society, heart disease is the one that we've made the most progress. We have very effective strategies to prevent and treat heart disease, and we have come a long distance. And how have we done that? Well, it's through advances in our understanding of heart disease and better treatments. Over the last 3-4 decades, we've come to understand what are the causes of heart disease, what are treatment strategies, what are things that people can do to prevent heart disease, and how do we implement those treatment strategies. In the 1970s and 80s, we really lacked a good understanding of heart disease. Our treatment consisted primarily of telling people to rest after a cardiac event. We had some early medications like digoxin and diuretics, but very few effective treatments. Through the late 80s and 90s, we've had a much better understanding of heart disease, and newer treatments were developed. Beta blockers, ACE inhibitors, and statins came along. In the late 90s and 2000s, we developed devices to help better treat heart disease. Stents to open up clogged up arteries, better and more effective bypass surgery and valve surgery, as well as devices like defibrillators, like support devices that can help a failing heart to stay strong. And in the last few years, we've developed even more effective treatment strategies to help a weakened heart. Where are we going in the future? Well, I think it'll really be about precision medicine. It'll be about trying to figure out for that each individual, what is it that's causing their heart disease? What can we do to change their heart health? Better understanding of the genetics of heart disease and how to treat those genetic disorders, I think will be one of the mainstays of future innovation and treatment of heart disease. And we need to do better. We need to do better despite all of the advances we've seen. We have noticed, as we've talked about, that life expectancy for the first time in almost 200 years has started to fall in Canada. For 3-4 years, we've seen a steady decline in how long people are living. Longevity has been falling. That is in part at least due to a rise in deaths from heart disease. For the first time in decades, we've seen an increase in the number of Canadians dying prematurely from heart disease. Heart disease deaths are on the rise. In the US, our colleagues actually saw that about 10 years earlier. In the 2010s, they started to see an uptick in deaths from heart attacks and strokes in both men and women. We've now started to see that in Canada in 2019, 20, and in the last 2-3 years. We need to do better. And why is it that despite all of our understanding that we have not done better and heart attacks and stroke deaths have started to increase again? Well, there have been a number of failed or missed opportunities to prevent and treat heart disease. Sometimes we're just not identifying the risk factors that contribute to heart disease and giving people the tools to modify those risk factors. We're sometimes not engaging people to understand what are their goals, their needs, and to individualize risk factor modification to their life circumstances. With all of the stressors and shortages and wait times in our healthcare system, there's sometimes a failure to diagnose the disease early. As a result, the disease progresses in the background, and sometimes we're finding people with much more advanced heart disease that could have been prevented or treated at a much earlier stage. And so as a result, proven treatment strategies are sometimes delayed or forgotten. And for some people, they need more advanced treatments. Some of those treatments can be very expensive, and access to those treatments have sometimes been a challenge in our healthcare system. Ultimately, though, as healthcare providers, we need to provide better supportive care. We need our patients to be part of the team. Together, we need to do better. And we know we can do better. Another demographic trend that has led to the increase in cardiovascular disease, really around the world, but particularly in Canada, is the aging of our population and the rapid rise of obesity. Canada is a graying population as baby boomers hit the age of 60s, 70s, and 80s where heart disease occurs. Baby boomers represent the largest group of individuals in our population, and so the epidemic of heart disease only increased as a result of our aging population. At the same time as our population has gotten older, it's also become more obese. Across the Western world, epidemics of obesity exist, and the combination of aging and obesity leads to diabetes, leads to high blood pressure, and leads to high cholesterol, all of the things that contribute to cardiovascular disease. Why is it that we're seeing both an epidemic of obesity as our population ages? Well, part of it is that as we get older, our metabolism slows down. When we're in our teens and early 20s, just sitting around, we burn a lot of calories. Our bodies efficiently use up calories. As we age, our metabolism slows down and we burn less calories. We've all seen that fit football player that in their 20s and 30s was all muscle. But as they get into their 50s and 60s, they start to become chubbier and look much bigger. Why is it? Well, if they continued to eat the same as they did when they were in their teens and 20s, but as their metabolism slows down, those calories accumulate and they become obese. So if our fit athletes struggle with that, certainly the general population clearly struggles with that. And that is a key contributor to the obesity epidemic that is leading to greater rates of cardiovascular illness. So we need to have a better understanding of that, and we need to support each other as we try to lead healthier lives. The obesity epidemic in the last 20 years in Canada has been on a rampage. It has risen substantially. In 2000, about 14% of the Canadian population was obese. By 2018, 27% of the Canadian population was obese. And the concern is in the next decade, it'll be over 40%. So that obesity epidemic is really contributing to the cardiovascular risk that leads to more and more heart disease. We know that risk factors, though, can be both modifiable and non-modifiable. So let's talk a little bit about that. There are things that you can't change. The non-modifiable risk factors for heart disease. You can't change aging. We all get older. There is unfortunately no fountain of youth, at least not yet. You can't change your race or ethnicity. We know that in certain ethnic populations, like the Canadian Native population, the South Asian population, heart disease is much more rampant. The genetics of those populations lead to greater rates of heart disease. There are also sex-specific, gender-specific issues that lead to an increase in heart disease. What causes heart disease in women is sometimes different than what causes heart disease in men, and we need to have a much better understanding of that. As well, there are genetic factors that lead to heart disease, things that are inherited within our families. At least historically, we can't change those. We can't modify those. I'm going to talk to you a little bit later that perhaps some of those genetic factors we may be able to change or modify. But we certainly have ways of modifying a number of risk factors that lead to heart disease. We can control high blood pressure. We can control lipids and cholesterol. We can prevent obesity. We can become more active. And we can all try to avoid exposure to tobacco products and smoking and vaping. All of these are modifiable risk factors, things that we have in our control that can help to reduce the burden of cardiovascular illness. First off, exercise is so essential for cardiovascular disease prevention. As little as 30 minutes of moderate exercise daily can significantly reduce the risk of heart disease. We need to incorporate that into our daily lives. Exercise helps to improve heart health by strengthening your heart muscle. Heart's a muscle. Any muscle gets stronger when you work it. You need to try to incorporate regular, structured exercise and physical activity into your daily life. Physical activity also helps to lower blood pressure and reduces the risk of diabetes, both of which contribute to heart disease development and propagation. Exercising regularly is an important thing that you can do to help mitigate your risk. Certainly, we all need to eat healthy and incorporate a heart-healthy diet. What does that consist of? Well, a diet that's rich in fruits, vegetables, whole grains, and lean proteins can help reduce the risk of heart disease. Reducing the amount of saturated fats and trying to eliminate trans fats in our diet, reducing the amount of sodium or salt in our diet, and avoiding added sugars can all help to promote heart disease health. Eating a heart-healthy diet also helps to control cholesterol levels and helps to maintain a healthy weight, all of which leads to heart disease. So certainly a heart-healthy diet is an important constituent of what you can do to stay heart healthy for yourself and for your family. We live in very stressful times. Economic distress, inflation, wars, a lot of conflict, all of which leads to societal stress. And managing stress is essential. We know that chronic stress contributes to heart disease by raising blood pressure, it raises cholesterol, and leads to inflammation that can damage our heart muscle and our heart blood vessels. Fortunately, a lot of research has gone into developing techniques that can help manage stress through meditation, deep breathing exercises, and yoga. All of this helps to reduce stress and improve heart health. Ensuring that you get enough sleep and incorporating physical activity also helps to reduce stress levels and improve overall cardiovascular health. So managing stress is an important part of heart disease prevention. Sometimes stress and anxiety can be too much though, and there are exceptional resources available in our communities. You need to seek them out. Speak to your healthcare provider if you're struggling with managing stress and anxiety. There are resources available to help. Certainly quitting smoking is essential. We were really winning the battle against tobacco for the last number of decades. Unfortunately, since the COVID-19 pandemic hit, there has been a significant increase in Canada of use of tobacco products, both cigarettes as well as vaping. Both cigarettes and vaping, e-cigarettes, damage the heart. Smoking is a major risk factor for heart disease. It damages the heart blood vessels, leads to more plaque formation, but it also directly leads to blood clots, things that trigger the heart attack, the stroke, and gangrene in our legs. Quitting smoking is essential. It helps to promote heart disease prevention, but also improves your overall health, reduces the risk of cancers, has significant benefits for mental health. So there's a lot of benefits that come from quitting smoking. And there are resources available, nicotine replacement products and other therapies that can help people quit smoking. There are a number of smoking cessation programs. Our own Cambridge Cardiac Care Centre has a smoking cessation team that can help people quit smoking, but a number of family practice groups and healthcare providers have resources available. If you need help quitting smoking, speak to your healthcare provider. There are strategies to help you quit. It is essential that you make that effort. But sometimes lifestyle interventions are not enough, and medications are required to help reduce the development and progression of cardiovascular illness. Fortunately, over the last few decades, we've developed very effective treatment strategies, medications that can help manage and mitigate both development and progression of coronary artery disease. Medications like antiplatelets, like aspirin, that help to prevent blood clots from forming on arteries. Medications like ACE inhibitors or ARBs, medications that relax blood vessels so they're less tense and less prone to damage. Beta blockers, medications that slow the heart down, take the work off the heart so it's not working as hard, less prone to damage. Certainly controlling cholesterol is essential for preventing plaque formation, and very effective treatments for cholesterol have been developed, the mainstay of which is statin therapy. Diabetes is an epidemic in our country, and we've had a number of our speakers speak to that. Fortunately, very effective treatment strategies for diabetes have been developed, and diabetes optimization is again an important part of how we prevent heart disease from progressing. And with those therapies, we've seen a dramatic reduction in the risk of dying from a heart attack in the first year. In the 1970s and 80s, a Canadian that was hospitalized with a heart attack had a 30% risk of dying within the first 30 days to a year. 1 in 3 Canadians with a heart attack died within 30 days to a year in Canada in the 1970s and 80s. The most recent data would suggest that with the effective treatment strategies that we've discussed, that risk of dying is now less than 5%. What a remarkable achievement. Over 30% down to less than 5% in a few short decades. It really speaks to the power of some of these therapies and our much better understanding of cardiovascular illness. But we know that someone who's had a heart attack, who has coronary artery disease and plaque buildup, they will continue to be at an increased risk of cardiovascular events with time. It's called residual risk. Your risk continues to increase with time. And we know that someone who's had a heart attack has almost a 15 to 20% risk of another heart attack, stroke, or dying of a cardiovascular illness within the first 3 years. So even though we've come such a dramatic distance, the battle hasn't been won. We need more effective treatment strategies. We need to reduce that residual risk. Fortunately, studies have shown that we can reduce that risk. More intensive blood pressure control can reduce that risk significantly. A very important study called the SPRINT trial taught us that the traditional target of a blood pressure of 140 in heart patients may not be enough. By getting the blood pressure down below 120, we saw between a 25 to 30% reduction in the risk of heart attacks, strokes, and dying from cardiovascular illness. So tight blood pressure control is essential for preventing heart disease progression. Similarly, intensive cholesterol control is also essential. Remember, the plaque is made up of cholesterol. All that cholesterol is gotten inside the wall of the blood vessels, and unless we get that cholesterol down very low, it continues to accumulate, continues to increase that risk of a heart attack or stroke. We know that every millimole reduction of LDL bad cholesterol decreases the risk of a cardiovascular event 20 to 25%. Effective cholesterol reduction is essential. And the mainstay of cholesterol reduction has been statin therapy. Unfortunately, statins have gotten a lot of misinformation. A lot of people are fearful of statins. They worry that it could lead to strokes. Well, in fact, studies show that statins do not increase strokes. We've studied statins in hundreds of thousands of individuals. We know these medications incredibly well. They do not increase the risk of cataracts. People are often fearful that they may get a lot of muscle symptoms with them, but the studies show that that risk is less than 0.2% of developing any muscle side effects. A lot of misinformation about the impacts of statins on cognition. People worry that it may lead to increased dementia and memory loss. Categorically, studies have shown statins do not adversely affect mental function, and in fact, they may prevent or reduce the risk of dementia from a type of dementia called multi-infarct dementia, or mini strokes that continue to damage our brains. Because statins reduce the risk of stroke, they can help to prevent multi-infarct dementia. They do not cause memory loss or dementia. People are sometimes fearful about the impact of statins on livers. Liver effects occur in less than 1 in 100,000 individuals. And if there is any rise in liver enzymes, when we stop the statin, it recovers. Similarly, sometimes people are fearful that it could affect the kidneys. Again, studies have categorically shown that there is no long-term effect of statins on kidney function. So there is a lot of misinformation out there. It's important, if you're concerned about statins, that you speak to your healthcare provider, seek out reliable sources of information, because this is such an effective strategy to help prevent heart disease. But in some people, even statins are not enough to prevent plaque buildup. Fortunately, a lot of research has gone into trying to develop newer strategies, and a group of medications called PCSK9 inhibitors have been a breakthrough in our understanding of cardiovascular disease prevention. This is actually a Canadian success story. A lot of the research on PCSK9 inhibitors were done here in Canada. And I was very fortunate to have participated in some of that research. And what we've learned is that PCSK9 inhibitors, 2 that are available in Canada, both substantially reduce the risk of cardiovascular events in those that are on statins and don't get their cholesterol low enough. Newer strategies for cholesterol reduction with PCSK9 modulators are also being developed. A lot of breakthrough in our understanding of cholesterol and how to reduce its impacts on cardiovascular health. As our previous speakers have spoken about, diabetes is a major contributor to cardiovascular illness. In fact, studies have shown that a diabetic that's had diabetes for 10 years is at the same risk of a heart attack as a non-diabetic that just had a heart attack. So diabetes is not just a touch of sugar. It is a leading cause of cardiovascular illness and needs to be treated effectively. And someone who is diabetic and has cardiovascular disease, they're at an even greater risk. So it is really important that we have effective strategies for preventing diabetes, and in those that develop it, treat it effectively. How does it do that? How does diabetes speed up all of this? Well, remember, heart attacks happen due to plaque formation. Plaque inside the blood vessel walls that narrows, can tear, and then blood clots on it, which triggers the heart attack or stroke. Diabetes speeds up that process. It damages the blood vessel walls, so they're much more prone to cholesterol buildup and narrowed and triggering heart attacks. Fortunately, much of what we've talked about already, healthier diets, more exercise, controlling weight, effective medications, can help to lower that risk of a heart attack and stroke in the diabetic population as well. There are very effective strategies to do so. And as Dr. Cheng has mentioned earlier, newer, better medications have been developed for diabetes that can specifically target and reduce the risk of heart disease. Medications like SGLT2 inhibitors and GLP-1 receptor agonists are two classes of medications that have been a sea change of cardiovascular disease prevention in diabetics. They dramatically reduce the risk of heart attacks, strokes, heart failure, and kidney failure. And many of them help to reduce weight as well. So there are better medications available. If you're a diabetic or your family member is a diabetic, speak to your healthcare provider. Ask them, are you on the best therapies to help prevent cardiovascular disease? Maybe what you're taking you've been on for a number of years. It may be controlling your sugar, but is it helping to prevent heart disease? Are there better therapies that can both control your sugar but also prevent the risk of cardiovascular events? Seek out, be your own advocate, and make sure you're on the best therapy available. We know that diabetics suffer from obesity often, and obesity is a leading cause of cardiovascular events. Controlling obesity through better diet and exercise is essential. So what is that role between obesity and heart disease? Well, first of all, we need to recognize that as a population, Canada is getting heavier. 60% of adults in Canada are either clinically obese or overweight. Obesity causes high blood pressure, high cholesterol, and significantly increases development of diabetes, all of which leads to heart disease. It also leads to inflammation. When we gain weight, particularly around our abdomen and belly, that causes inflammation. That inflammation damages the lining of blood vessels, which makes them much more prone to forming plaque, narrowing, and triggering heart attacks or strokes. Reducing obesity, controlling weight through regular exercise and a healthier diet helps to reduce the risk of heart disease. But there's a lot of fad diets out there. I want you to be very cautious about that. People that struggle with weight often struggle with these fad diets. They lose weight quickly, but the weight often comes back quickly as well. And that cycling of up and down is really not healthy. You need to have a heart-healthy diet and incorporate exercise as a strategy to help control weight. Fortunately, we have again developed treatment strategies, therapeutics that help to reduce weight. One of the breakthroughs in obesity management has been with a group of agents called GLP-1 agonists. You might have heard of drugs like Ozempic, Wegovy, Victoza. These all belong to a group of medications called GLP-1 agonists. They were first shown in diabetics to reduce diabetes effectively and reduce heart attacks and strokes. But now we've studied these agents in the non-diabetic population that's struggling with their weight. And what we've seen is that beyond diet and exercise in people that require it, these therapeutics help to lower weight. And what is different is that the weight stays down. There is that cycling that we see with diet where weight goes up and down. We do not see that in people with GLP-1 agonist therapy. The weight stays down. If they're on the medication, they're continuing to follow a diet that's appropriate and exercising regularly. The drugs that are available to us right now reduce weight on average about 10% from wherever you start. That weight seems to stay down. And then it has a number of other benefits for the heart beyond just lowering weight. It improves blood sugar control. It reduces inflammation. These groups of medications have been shown to lower cholesterol and lower blood pressure. In animal models, they reduce plaque formation, and previous studies in diabetics have shown that they reduce the risk of heart attacks, strokes, and cardiovascular events. We've now studied them effectively in the non-diabetic population. I was very fortunate to be a principal investigator in this study called the SELECT trial, where we put half of our cardiovascular patients on a GLP-1 agonist, semaglutide, and the other half on placebo. And what we saw is that very quickly, those that were taking the GLP-1 agonist, not only did they lose weight much more effectively, but they had a lot lower rates of heart attacks and strokes and cardiovascular events, as much as a 20% reduction within 2 to 3 years. This is a breakthrough in our understanding of obesity. Obesity is a disease that we can control and treat with effective diet, exercise, and for those that require it, there are now medications that can help mitigate the risk of cardiovascular disease. So when we think about the things that lead to cardiovascular illness and premature plaque formation, we think of traditional risk factors like high blood pressure, diabetes, cholesterol, obesity, smoking. But what we've also learned in the last few years is that there are non-traditional risk factors, things that in a specific individual can lead to their development of heart disease. There are viral illnesses that can cause damage to the heart and lead to cardiovascular disease. Some recreational drugs that are used, like marijuana and cocaine, can damage blood vessel walls and increase cardiovascular events. In women, we know that there are very specific risk factors related to hormonal changes at times of pregnancy, those that develop gestational diabetes or develop eclampsia or preeclampsia or blood pressure changes during pregnancy, increases their future risk for cardiovascular events. And after menopause, we know that risk factors go up substantially in women. So better understanding of cardiovascular risk in women is essential to help reduce that risk. We know, as we've talked about a few times, inflammation is a major cause for heart blood vessel damage, and certain conditions like lupus and rheumatoid arthritis and gout are inflammatory conditions that can lead to systemic inflammation throughout our blood vessels that can damage them. And then there are genetic risk factors specific to an individual that can increase their risk, things like lipoprotein A. Let's talk about some of those things now. So we've talked about the great success that we've had in reducing cardiovascular events over the last 3-4 decades. Unfortunately, much of that success was primarily in men. Through the 80s and 90s and early 2000s, we saw a dramatic reduction in the risk of dying of a heart attack and stroke, primarily in men. During that same time, we either saw no change in deaths from heart attacks in women, or perhaps even a slight increase in risk. In the 70s and 80s, more men used to die of heart attacks and strokes than women. By the early 2000s, that had completely reversed. More women were dying of heart attacks and strokes than men. The treatments that we had developed worked primarily in men. Fortunately, as we started to better understand the impact of cardiovascular illness in women's health, we have developed better treatment strategies, and in the last few years, we're finally starting to see a reduction in the risk of dying of a heart attack or stroke in women. We need to do better. We need to understand the risk for heart disease in women and develop even more effective treatment strategies. Some of that understanding has started to come together. As we've talked about, there are hormonal changes that are specific to women that raise their risk. During pregnancy, if women develop prediabetes or gestational diabetes, that increases their risk. If they have high blood pressure effects during pregnancy, conditions called preeclampsia or eclampsia, that can increase their risk. Women sometimes have polycystic ovarian syndrome, a condition where cysts form within the ovaries that can increase future cardiovascular risk. We also know that traditional risk factors sometimes have more effect in women than men. Smoking damages the heart of both men and women, but particularly women. And unfortunately, we've seen an increase in smoking rates in women while men have smoked less in the last few decades. We need to change that trajectory. And then there are psychosocial risk factors, lifestyle things that impact women sometimes more than men. Socioeconomic deprivation, food insecurity, stress, anxiety, all of those things affect both men and women, but particularly women. So we need to be cognizant of the various things that lead to heart disease in women and make sure that as healthcare providers, we're providing effective resources to our female patients to help reduce their risk of cardiovascular illness. A lot of these risk factors that we've talked about increase inflammation in our blood vessels that damages the blood vessels, leads to plaque formation, and ultimately triggers heart attacks or strokes. That same inflammation, though, can also directly damage the heart muscle. It can lead to scarring in the heart muscle and fibrosis, and that weakens the heart and leads to heart failure. So better understanding of the causes of inflammation in our bodies is important, and treatment strategies are essential. Several treatments are in development or have been developed to reduce cardiovascular inflammation. There are already medications like colchicine that have been around that have now been shown to reduce inflammation and potentially reduce cardiovascular events. But even newer therapies are under development or under studies that may further reduce cardiac inflammation and reduce the risk of heart attacks, strokes, and heart failure. We're fortunate that at the Cambridge Cardiac Care Centre to be involved with a number of those studies, and we're hopeful that some of these therapies will help to reduce cardiac inflammation in the future in our patients and help reduce residual risk going forward. We also know that genetics plays a very important role in cardiovascular events. Some people have heart attacks even when their LDL cholesterol is very low. And traditionally, we've thought of LDL as the bad cholesterol. Well, how is that possible? I kept talking about the fact that heart attacks happen due to plaque formation and it's cholesterol inside the walls. Well, if your LDL is very low, how did you end up with that plaque? Well, it turns out that some people inherit another type of genetically derived cholesterol called lipoprotein A, or Lp(a). And Lp(a) is a very toxic cholesterol that some people inherit genetically. It has properties very similar to LDL, but sometimes is even more damaging. And it's something that's genetically inherited. It's not from your diet. It doesn't change with exercise. It's inherited. And you have that high lipoprotein A from birth. Because some people are exposed to this high cholesterol right from their birth onwards, sometimes it leads to a lot more damage and a lot more plaque formation. And in fact, studies show that 1 in 5 Canadians have the gene for lipoprotein A. It contributes to 1 in 14 heart attacks in Canada and 1 in 7 cases of aortic valve disease. It is a significant contributor to cardiovascular illness. Fortunately, testing for lipoprotein A is now covered in Ontario and in most parts of Canada. So make sure that you get your lipoprotein A checked. Ask your healthcare provider, was it checked? If it's high, it tells you that you're at risk for future development of cardiovascular disease. You need to do everything else right to reduce that risk. Unfortunately, there are no approved treatments yet for lipoprotein A. So what that means is if you have lipoprotein A elevation, everything else has to be tightly controlled. Blood pressure has to be very well controlled. Other types of cholesterols have been controlled. Diabetes has to be controlled. All of those things that we've talked about, we can control until we have treatments for lipoprotein A available. There's very exciting research ongoing, though, to reduce lipoprotein A. Gene silencing therapies are being developed. Incredible. We may be able to turn off the gene that causes lipoprotein A to be produced. And studies with these therapies show that we can potentially lower lipoprotein A with these gene silencing therapies by as much as 80%. Really exciting work. Great advancement in our understanding and potential treatment for cardiovascular illness. Again, I'm very fortunate to participate at the Cambridge Cardiac Care Centre in a number of trials ongoing to prove that these lipoprotein A lowering therapies will reduce heart attacks, strokes, and valvular heart disease. Stay tuned. A lot of exciting information coming. Gene therapies are on their way. So we are really on the verge of a wave of new gene therapies, not just for lipoprotein A, but other gene therapies that can reduce heart attacks, reduce scarring in the heart, reduce heart failure, and potentially even aortic valve disease. We may have gene therapies specifically targeting various things that we sometimes inherit within our families. Historically, we used to say if it's in your family, we can't do much about it. But maybe we can. A whole wave of new gene therapies are coming. Stay tuned. Exciting times ahead. But we know that we already have ways of controlling as much as 90% of the risk of heart disease. By more effective treatment of cholesterol, diabetes, blood pressure, controlling weight, and quitting smoking, we can reduce the risk of cardiovascular events by 90%. It's within us to do that. It's up to each of us to try to do what we can to stay heart healthy. Prevention starts with you. Replace unhealthy habits with healthier ones. Start with eating heart healthy. More fruits, vegetables, less processed foods, less salt, less simple sugars. Try to incorporate a little bit of physical activity. Take it one step at a time. Start slow. Start 10 minutes. Gradually increase that. Try to develop a fitness regimen that you can sustain. And it is really about sustaining it, staying motivated. Lifestyle changes are not a quick fix. There is no fast way of doing this. You need to adopt a healthy lifestyle that you can stick to over the long term. And that's really the reason that these fad diets don't work. We just can't stick to an all-celery diet. So as a result, don't adopt lifestyle changes that are just not sustainable. These are things that we need to do for the rest of our lives. Staying heart healthy is a long-term journey. And there will be times when you lose that motivation, you fall off the track, you're less active, maybe not eating as well as you did before because of stressors. Recognize that. Get back on track. Sometimes it helps to buddy up. I know for me personally, when I'm exercising with my wife, I'm often much more motivated. If I start to lose motivation, she encourages me, gets me back on track. So buddying up is a good way to make sure both of you stay heart healthy. But set realistic goals. It may not be possible that I ever run a marathon, but I can certainly go for a half-hour walk. I can do a bit more physical activity each day. Baby steps are still better than no steps. Take each step counts. And remember to ask questions. It's your health. Healthcare providers are out there to guide you on ways that you can make lifestyle changes and adopt perhaps therapeutics that are required to mitigate or reduce your risk of heart disease. Be your own advocate. In our healthcare system that's so stressed and taxed and often access is limited, it is really essential that you take that upon yourself to ask questions, be your advocate, find out from your healthcare provider, what are the things that are putting you at risk for cardiovascular disease? What can you do about it? And remember to reward your successes. If you set a goal for losing 5 pounds in 6 months and you've achieved that, pat yourself on the back. That's fantastic. Set that next goal. Keep going. This is a long-term journey, and staying motivated is the essential component to success in heart disease prevention and therapy. So I thank you for having stayed with us for our 20th annual Healthy Heart Day as we celebrated the achievements we've had over the last 20 years and discussed ways that we can continue our fight against heart disease. I look forward to seeing you again in our 21st event. Thank you so much for having stayed with us through this very exciting event. An event like this clearly requires a lot of organization, and we need to celebrate and thank those that have helped to put this event together. Chief among them is Michelle Pandey. She is a former ICU pharmacist and a lead researcher at the Cambridge Cardiac Care Centre. She leads an exceptional group of healthcare providers that are dedicated to advancing our understanding of cardiovascular disease and developing better prevention and treatment strategies. She's made it a mission to try to recur this event year after year to help bring you better information, reliable information, and to help guide all of us to lead healthier lives. Thank you, Michelle, for your dedication and your hard work, and your efforts year after year to ensure the success of this event. We also need to thank the chair of the board of directors of the Cambridge Prevent Clinic, Dr. Michael Lowry. Dr. Lowry is the chair of our board that puts this event on year after year. He is the former chief of staff at Cambridge Memorial Hospital and a former supervisor at the College of Physicians and Surgeons of Ontario. And with that expertise in healthcare, management, and oversight, he has tried to ensure that this event remains relevant, timely, and delivers the quality of information that people require. And thank you, Mike, for all your efforts, your dedication to ensure this event is successful again, year after year. And we need to thank Kesh Desanaki. She is our patient and community representative. Kesh is an engaged individual who participates in so many community events and leads our efforts at ensuring dissemination of this information through social media and advertising. She leads our efforts to make sure that you know about this event, you know the strategies that can help you stay heart healthy. Thank you so much, Kesh, for all your dedication over these years. Certainly an event like this requires a number of different groups and participants. For their support, I must thank them. The Cambridge Cardiac Care Centre and the Cambridge Cardiac Rehab Program helped to put this event together. But an event like this requires a team. The Healthy Heart Day Committee, as listed on our slide, is a diverse group of both healthcare providers, business individuals, people with insight in media, and people from the community that help us to get this information out to you. And it is their dedication and hard work that helps to put this event together. And this committee listed was key to the success of our event today. We're grateful to our media sponsors that help us get the word out. Rogers TV is airing this in the Waterloo region multiple times, and I thank them for their continued support to help promote heart health in our region. The Waterloo Region Record newspaper again has helped us to promote this event, to get the word out, and their contributions to information and propagation of heart healthy information in our region is essential. We also have radio media sponsors that have helped us to get the word out. 96.7 Chime FM, 106.7 Country FM, and City News 570 have all helped us to get the word out on Healthy Heart Day and help promote heart health in our region. I thank our media sponsors for all of their support. But an event like this is clearly something that requires a lot of resources, and we're grateful to our pharma corporate sponsors that have helped to allay some of the costs required to put an event like this together. I thank them for their dedication in promoting heart health really across Canada. This is, however, a community event, and community sponsorship and engagement is essential. And I am so grateful to the Mayor of the City of Cambridge, the Cambridge City Council, for having supported this event year after year. As well, the Cambridge North Dumfries Ontario Health Team has helped us to promote this event and get the word out on heart healthy strategies. Element Printing has for the last 20 years helped us develop the resources of posters and media information that we can help to get out to promote this event, and I thank them for their support. Financial contributions to this event have also been led by the Knapp Group and Amanda Knapp at RBC Wealth Management Dominion Securities, and I thank Amanda and her team for their continued support. This event, as we've talked about, is raising funds for Heart and Stroke Foundation of Canada, and you will see on your screens a location you can go to on the web to donate if you're able to. Thank you for your support of Heart and Stroke Foundation as they try to get more information out and help in this fight against heart disease. But I must obviously acknowledge the exceptional staff of Cambridge Cardiac Care Centre that helped put this event on year after year. I am so fortunate and honored to work with such an exceptional group of healthcare providers that make it their life mission to help promote heart disease health and help in the fight against heart disease with better research, better information, and implementation of strategies that we can all take to heart as we try to lead heart-healthy lives. I'm so thankful to work with such an exceptional group of people. As you know, and as I've talked about earlier in this presentation, this event is put on in memory of our grandma Linda, Michelle's mother, who we lost far too young, under the age of 70, from heart disease, heart attack, and the ravages of diabetes. It is in her memory that we put this event on year after year. Grandma Linda, we love you, we will always remember you, and you are the guiding light that really teaches us and guides us to stay heart healthy and to help keep a healthy community. But this event is really about you, the participants. Thank you for having stayed with me throughout this event. Thank you for having participated. I hope you have set one of those SMART goals that we talked about so many times during this event. I do want you to remember to please go to the website, the QR code on the screen, to give us feedback as to how we did today, how we can make the event better in the future. And thank you for having joined me today for our 20th annual Healthy Heart Day. I look forward to seeing you on our 21st event, and I hope it will be even better next year. Thank you so much for having joined me today. Have a good rest of your day.